Good morning and welcome everybody on this auspicious day of Gandhi Jayanti. I, Dr. Gayatri Patel, Faculty Psychiatry, MLDT, and my co-host, Dr. Nikunj Jani, Associate Professor, Department of Repertory, and Editor of JISH. All institutional events begin with prayers, so I invite Dr. Bhairavi and team to come and sing our institutional prayer, which speaks of developing inner strength and insight, which will be followed by Gandhiji's favorite bhajan, Vaishnava Janto by Narsi Mehta, which is most appropriate for all health professionals as it beautifully renders a picture of compassion. So I call Dr. Bhairavi along with her team, Gurmeet, Kajal, Bhushan. Please come in.
शक्ति देना मन विजय करे दूसरों की जैसे पहले खुद को जय करे हमको मन की शक्ति देना भेदभाव अपने दिल से साफ कर कदम भरे दूसरों की जैसे पहले खुद को जय करे हमको मन की शक्ति देना मुश्किलें पड़े तो हम पे इतना कर्म कर साथ दे जो धर्म का चले तो धर्म पर खुद पे हौसला रहे बदी से ना डरे दूसरों की जैसे पहले खुद को जय करे हमको मन की शक्ति देना वैष्णव जन तो तेने कहिए जे पीर पराई जाने रे वैष्णव जन तो तेने कहिए जे पीर पराई जाने रे पर दुखे उपकार करे तो मन अभिमान नाणे रे वैष्णव जन तो तेने कहिए जे पीर पराई जाने रे सकल लोक मां सहुने बंदे निंदा न करे के नीरे वाचकाच मन निश्चल राखे धन धन जननी के नीरे वैष्णव जन तो तेने कहिए जे पीर पराई
Tamasoma Jyotirgamaya. That means lead me from darkness to light. With the lightning of the lamp, may the darkness be replaced with light and ignorance by knowledge. I call upon the stage our chief guest, Dr. Tarkeshwar Jain sir, our guest of honors, Dr. Rajkumar Patil sir and Dr. Mangesh Jatkar sir. I also request our speakers for the day, Dr. Devadiga sir, Dr. Jawar Shah, and Dr. Anand Kapse, and Kumar sir and Bipin sir to please come on stage. I request the dignitaries to garland the portraits of Mahatma Gandhi ji, Dr. Samuel Hahnemann and Dr. Emil Dhawale. Thank you, everyone. I now call upon Dr. Sunita Nikum, Professor and Head of Department of Psychiatry, Dr. Dhawale Memorial Homeopathic Institute, Palghar, to welcome our dignitaries. She is also one of the part of the authors team as well. Sunita, ma'am, please.
We, on the behalf of Dhawale Trust and Dhawale Memorial Homeopathic Institute, I welcome our today's dignitary, our chief guest, Dr. Tarkeshwar Jain sir, our guest of honor, Dr. Mangesh Jatkar sir, and another guest of honor, Dr. Rajkumar Patil, Dean of Homeopathic Faculty, MUHS, and the Management Council member. We also welcome our today's speaker, Dr. Prabhakar Devadiga sir, Dr. Jawahar Shah, and Dr. Anand Kapse. I also welcome all the authors of this book and their families. We are thanking the authors' family for supporting our authors to give time to write their chapters. We also welcome yeah. We also welcome all the principal and teachers of various colleges. We also welcome all the faculty members from MLD-MHI, ICR family, physician, students of homeopathy, and our well-wisher. Let me share with you today's program. We are starting with the seminar on psychology first. It will be followed by the introduction of a book, Foundation of Psychology and Homeopathy. It will be followed by the inaugural function and the inspirational words by our chief guest and guest of honor. Thank you.
Thank you, Dr. Sunita. We will be starting with the seminar now. The first speaker of today is Dr. Prabhakar Devadiga. He is going to speak on the topic, Importance of Psychology in Hahnemannian Thought. We all know Dr. Devadiga. He's the department head, professor and head of the department, Organon of Medicine at CMP Medical College. He's an extremely passionate and dedicated homeopath, and he's also honorary physician in different departments like medicine, surgery, psychiatry, and orthopedics. He's ex-member Board of Studies, MUHS. We all know that Dr. Devadiga is a very popular teacher and known for simplifying the concepts of Organon and its application to clinical practice in a very live way. Dr. Devadiga, please come up.
Good morning, all of you.
Very good morning.
Now that, being the first speaker,
Century Manai.
no, sir. Because from
Society, 20 years.
Anyway.
They are very span.
Yes, sir. That is true, and it should be within a particular time of period. So, we are talking about psychology in Hahnemannian thought. It's very interesting when we talk about psychology in Hahnemannian thought. What was the psychology? Let's know a little about the history. We all know what is psychology. I don't need to give the definition of psychology. It's a science of studying human mind, its function. There are various definitions. We also think about psychology as a mental characteristic of an attitude of a person or a group. This is the definition in the Oxford Dictionary. Prior to that, let's understand what Hahnemann had to say. Now, we all know, and we should know rather, we should take pride in the fact that Hahnemann was the first person to start to work for mentally ill patient. And this place is still there in Germany, in Georgenthal, near the forest of Thungria, they call, right? And he was given this charge by Duke Ernst, one of Gotha. Very interesting is that his sister fell ill, and those days the mentally ill patients were beaten up, put on the road, and he didn't want his sister to go through. That's why he was asked to start this hospital. The very interesting part is the psychoanalysis, everything began with Sigmund Freud, who stayed only 180 kilometers from this, so near. So a hospital first started, though the credit is given to Pinnell, who broke the chain. It was like on advertisement, he broke the chain of some people. But prior to that, Hahnemann was the first person to treat humanly the person of mind. So we are now not talking about psychiatry. We are just trying to understand that the first person to think that mind plays an important role. So today I will highlight some of the aphorisms which will make us understand where Hahnemann gives importance to psychology. It begins from aphorism 5 itself. Now, after knowing about the knowledge of disease, the next step is what is useful for the physician to understand about acute disease and chronic disease. So acute disease, he is talking about the exciting cause, which is more important, but we'll come to this part. He says the chronic disease is caused due to a fundamental cause, which is miasm, and what is important for us to find the miasms are these points. And you can see, apart from ascertainable physical constitution, we talk about moral and intellectual character. And to understand that, psychology is must. And when we need to teach our students this, what is moral and intellectual character, it's not a flaw. It's not a flaw, but it's part Today we understand that lot of research has gone into this. I have been reading through some research, and research talks about genes having a role to play in the moral and intellectual character. Many research has gone into it. So whether we want to consider miasm as part of genetic phenotypes, that is for us to decide. His social and domestic relations. Today we have to teach the new syllabus, and I would definitely congratulate NCH for giving such a beautiful syllabus of psychology. Let me tell you, my junior teachers really want to say we want to study again. The way it has been made, I really want to be telling that the way it has been made, it's a boon. If we teach it properly, the student will be ready from first year itself to take a case in a very beautiful perspective. And this social domestic relationship, sexual function, now we are teaching even this in relation to emotions. Now we have to teach this. So you can understand it's there in the syllabus, so nicely put. So Hahnemann talks about finding the fundamental cause based on these factors, what we call as miasm. So we all take the case in detail, and this is what we come to a constitutional remedy, and this is what the symptoms are. Aphorism 88, he talks about case taking. After taking the detailed history, what we need is, after the voluntary details, nothing has been mentioned, then we have to ask about his state of his disposition and mind. If the patient does not voluntarily give, we need to ask the patient's disposition of mind and disposition. It's not psychiatry. It's psychology, because it is normal. If a person is weeping, weeping is normal. A person gets angry, getting angry is normal. How much and how much not? Because if he gets angry more than others, but he is able to do his day-to-day activity, he is still healthy. And based on this, we are going to prescribe. So we would not call that we are psychiatrists, but psychology definitely plays a role. And this is what Hahnemann has written in his aphorisms, in our history taking. Then again in aphorism 96 and 98, the difficulties while taking the case, he talks about when we are taking the case, we have to understand the different psychology of the patient, where we have to understand what the patient is going to tell and how is he speaking to us. This itself is a one big lecture. I would like to encapsulate here. So, hypochondriacs and stoic personalities, the so-called stoic personalities, where he talks about the persons do not, there are people who come to our clinic and say कि मैं तो खुद नहीं आया था, मेरी बीवी लेके आई. Nothing wrong with me. And then you have to take his history. Quite a number of times on our face they say, मैं homeopathy believe नहीं करता. Right? How do we take the case? And this aphorism gives us beautiful idea about how to go about that. And that is what we need to teach our students, how to manage each of these different mindset. For that, we have to understand the basic reason behind the mindset. It is so easy for anybody to be labeled as hysterical. To understand the hysteria is more important. Is it a psychiatric illness or it's a psychology? That needs to be decided. The moment you say it is psychiatric, then the patient ends up in taking psychiatric drugs, and we see so many of the people in this world taking medication for no fault of theirs. That is their disposition. Now this concept of disposition, which Hahnemann has said, it's very important. In psychiatry, there is one word. There is nobody normal and there is nobody mad. Everybody is in between. Our Dr. Dhawale, I had never had the experience of learning from him, but my teachers would say that he would take lectures upon lectures about normal human being. That's very beautiful. I did not get that opportunity, but some of them who must have got the opportunity to learn from him, they say it would be lectures on what is normal. So learning normal is very important. When we say knowledge of disease, where a physician has to get a knowledge of disease, there are two parts. What is a disease and what is that individual disease. And in that what is a disease, you have to know what is normal to know what is a disease. So, it is important for us to understand psychology in a better way, because up to now we as homeopaths have been understanding it by practicing and intuitively. But if there is a proper perspective to it, it becomes easier for students. And today's students do require SOP every time. The students today, they are much more brilliant than us, mind you. It is according to Charles Darwin's theory, so that we cannot question about that. But what we give to them is more important. So, again, one more place why the psychology is important, what Hahnemann talks about psychology important is, in chronic cases, investigation of true complete picture and its peculiarities demand circumspection, tact, again, knowledge of human nature, caution in conducting the inquiry, and patience in an eminent degree. Aphorism 210, once again he says that when we talk about mental diseases, they are not separate from any other disease. It is there in the invisible organ of mind. That's the word which he says. And he says, in all cases of disease, the word underlying all cases of disease, we are called upon to cure. The state of patient disposition is to be particularly noted. So we need to note down the patient's disposition. So here I would like to share one small case, very, very small case. So a patient came recently. The patient came with severe headache. The headache is so severe that she took all the allopathic medication, no improvement. And she went to neurologist, no, they sent to the psychologist, psychiatrist, no improvement, severe pain. So as when we take the case, she talks about how her husband mistreats her. So she started crying and says that my husband is not very been kind to me, he doesn't take care of me. So I said, how do you say that? Does he beat you up? No, no, he doesn't. But he's not nice. He doesn't care for me. I said, how do you say that? So she says that, see, he is changeable, doctor. I do not know. He projects to the world that he's so nice that when you will meet him, you will find he is the best person in the world. But for me, he is not. He will praise a dish, and I will make that dish for 5-6 days, and he will say, what nonsense, you are giving the same dish, you give me different. Then he will say, what type of dress are you wearing? Change this dress. When I will wear that, he says, why don't you do this? Change this. And then she went on crying. Her mother was also there. She said, yes, yes, he is like that. And it was a crying thing. Now here, important is that when the person is crying, complaining about this, our remedy, we think of a remedy differently. But as Hahnemann said, you have to have patience. I said, tell me more. Tell me more about it. So when the patient was telling that, what happened? Means why are you, after 14 years of marriage, why are you telling this now? Was he not? He was like that, but it has increased now. So I said, what happened? No, he has got a friend now. And with friend, no, he is so much impressed with the friend. I said, what about that friend? They are staying in town. They are staying in town, in a very small place. And she wears traditional dress, and he thinks that that person's wife is wearing a traditional dress, and he expects me to wear a traditional dress. Very important gestures, no? Traditional dress. I am supposed to expect it to, I said, but does he tell that to his other people in the family? Oh no, my sister-in-law is much more modern than I am. He never tells me. So I said, do you then change the dress? Why I will change? The picture changed. The person who is crying, suddenly he has got a different idea to put. So remedy which came up after that was platina. And the interesting part is, how when we prescribe like this, after giving platina, next week she comes and says, I am so feeling good. So feeling good. Headache has disappeared. So I said, what do you mean by feeling good? I am very comfortable. I am feeling nice. Now, this is what Hahnemann talks about mind and disposition. So what appears, it requires tact, circumspection, and understanding human nature. We need to know various cultures. We need to know various cultures, because every culture has got its own various expressions. We need to understand that. This Hahnemann has written 200 years ago. That's the beauty. Sigmund Freud, Carl Gustav Jung, they all came 100 years after Hahnemann. When they talked about psychology, he had already written this book much before. We are the descendant of this person who talks like that. He says in aphorism 211 that this holds good to such an extent that the state of disposition of mind often chiefly determines the selection of the homeopathic remedy. Now, this sometimes also gives rise to a little difference in our science. We have got different schools of thought. Some people think that only the PQR is important, and some people say that mind is being taken. Based on this, we have been called as Bombay School of Thought for practicing homeopathy. We talk about 211 and there is 153. So this is a different seminar, 153 versus 211. We can always talk about this, and that's an interesting thing. (224) talks about very interesting phenomena: disease resulting from faults of education, bad practices, corrupt morals, neglect of mind, superstition, ignorance, and responds well to sensible friendly exhortation, consolatory arguments, serious representation, and sensible advice. Each of this requires a lot of learning. The understanding of psychology will definitely play an important role in doing this. It's written, and this is the first basis of counseling anywhere in the world. Prior to that, a structured counseling was never there. Now this, when we talk about counseling, counseling is a part of psychology, this was never there anywhere in the history of medicine. A structured one. These are 4-point structured ones, very important, and I am sure most of the senior teachers will agree to that. They do that day in and day out. But are we labeling it? Are we making a data out of it is important to be seen. Maybe tomorrow, if we make data about this itself, we'll make a change in understanding, because then it is very easier for the student to take from there. Discussing this will take definitely more than 2 lectures. Based on this, I had an interesting interaction with a small child, and I want to share this, and it's very beautiful. It came as an intuitive one, but it's very interesting. The child was brought to me, adaptive disorder. And the parents said, we are at our mind's end, we do not know how to handle this. The child is very naughty, does not listen to us, and he has become sort of angry. He destroys things, breaks things, and beats up his sister, who is 2.5-year-old. Now in my clinic, the parents are sitting, the child is sitting, and the sister is standing behind him and peeping from behind the chair where her brother is sitting. So I asked him, after the history has been taken by the assistant doctor, I asked him, you do get angry very often? Just a direct question. Yes. He said, "Mujhe gussa aata hai." I said, I heard that you also have beat up your sister. Yes, I am beating my sister. I said, no, these are direct questions, of course, but then a child, sometimes we cannot ask questions. So I said, why do you beat up the child? Why do you beat up your sister? Then the answer was so nice. Doctor, before she was born, I was getting 100% love from my parents. After she has come, it has become 50%. So I don't like her. I am beating her for that. This is a statement. I said, I agree with this. No, I agree with you. He says, you used to get 100%? He said, yes. And when your sister came, it became 50%? I said, yeah. I said, what about your sister? Whom does she love as a brother 100%? So she loves me 100%. So 100 plus 50 is now 150. So now you have got 150. After your sister came, it was 100, now become 150. He told me, yes, doctor, you are right. Can you believe that single statement changed the person's expect? Next time onwards, no beating. He got to understand that the child's mind was very clear. My 100% has been taken 50. Just changing a little understanding that now it has become 150. The parents behind sitting there were just crying. Okay, how we did not get this idea before to explain to the parent, to the child. No? So children do not require too much. But that developmental time when the person is having this sort of, this is a single statement change. It may not be applicable to all the patients, but it does play a role. And this is what I meant, sensible, friendly exhortation. No? Sometimes consolatory arguments that you lost 100, you get 50, now you are getting 150. It's a small argument with the child who can understand that much only. That much only. Trying to tell, no, your parents love you equally, that child does not understand. Child wants my 100%, mera 100 chale gaya. Right? So this is what Hahnemann's concept in psychology, what Hahnemannian concept is. So it's very simple. The advent of the book which we will get, I think, will definitely help us to go further in that. Further more studies will be required. But Hahnemann, let me tell you again, was the first person to start to understand mind as a concept for disease, to understand that mind is important part. To an extent, he says that when you do not get characteristic symptoms, mind, the disposition is the only way we can prescribe. And that is how all the teachers from Kent downwards have been teaching us materia medica from that point of view. We all learn natrum mur in a different way. We learn lachesis. So we talk about human beings, personification. What is personification is, again, psychology. Thank you very much.
Thank you. Thank you, sir, for a very lovely presentation. So you have to be on top. You have to come back up. Dr. Devadiga. I request Dr. Manoj, Trustee MLDT, to felicitate Dr. Devadiga. Please give a big round of applause. Thank you, sir. Thank you, Dr. Manoj. I call upon Dr. Nikunj to take up.
I think our next speaker needs no introduction. Dr. Jawahar Shah is known to all of us. He's the Director of Mind Technologies, and he has been a clinician for the last 45 years. He's an enthusiastic student of Dr. M.L. Dhawale. And in fact, he has carried the legacy of Sir's teachings across the globe. He has lectured nationally and internationally in over 25 countries and successfully conducted thousands of seminars. As an entrepreneur, we know him as a developer of Welcome Cure. As a technocrat, the softwares developed by him and his team are used in probably homeopaths globally in 140 countries. He was on the government task force of Maharashtra government during the COVID pandemic, and he has distributed kits as per the Ayush guidelines to 1.5 million needy people. Sir shall be talking on the topic of representation of mind in repertory and softwares and its utility in clinical practice. I call upon Sir to please start his presentation.
What's your good name? Nikunj. Huh? Nikunj, thank you very much for a wonderful introduction. जिधर बुलाएगा उधर लगा देगा. Can we have the lights? Okay. Sorry. Very good morning. That should be the energy. You know, wonderful representation by Dr. Devadiga. उनकी प्रभा तो सब जगह पे चली हुई है. You know, I remember one of the sessions which he shared beautifully was on hospitals in, थोड़ा सा एको आ रहा है, hospitals which were there in USA and how much homework he had done. Same way, how beautifully he represented the entire thing. Can I have the slide changer, please? Okay. ये नहीं है, ये गलत फाइल आप शेयर कर रहे हैं. पीपीटी है. You will get a, you know. मनोज ये 3-4 मिनट गिनना नहीं है प्लीज. नहीं तो मेरे में पेन ड्राइव में है. See, I'll tell you some very interesting thing about Dr. Dhawale. You know, we used to work so hard, me and Dr. Tiwari, andar hai de. He would drop us at 2 o'clock, 3 o'clock in the night, and he would be there in clinic at 8 in the morning. And, you know, Prabhakar said, according to psychology, nobody is normal and nobody is mad. But he was mad about teaching. He was mad about disciplines. And amazing knowledge we had. You know, whatever I am today, I thank him. He made a man out of me. So I pray to him. And whatever I am today, it is because of my parents, my guru, and God. So nothing belongs to me. He has to go to today's psychology book, नीचे है. इसलिए मैंने ओमकार को भेज भी दिया था कल. Yeah. You know, sometimes normality takes time to understand. So, what I am going to talk about little aspect, I have been doing a lot of things. Let's not. Yatha Brahmade Tatha Pinde. Now, this is what Sir has taught us beautifully. You know, whatever is there in the universe, it is within us. And what was the most beautiful thing he taught us was universal mind, which nobody could talk about it. And how beautifully he connected Honeyman with homeopathy. And today we are going to share little bit about emotional aspect, the behavioral aspect, and the conscious and subconscious states. Okay? So what I am going to share with you, because the time is limited, I am going to share something very interesting. There is a thought, and thought ke baad, what happens? The feelings, and then comes the behavior. So we are going to talk about how the whole thing gets affected. Okay? And we are going to discuss about the behavioral aspect. You know, the external face of the mind is represented through behavior in the repertory and different emotional states. Okay? And this gets represented and it gives us a chance to find the simillimum. And we are going to take it with the help of a case which discusses about the growth, development, and decline, and then recovery. How the patient's mind developed, the remedies which are coming very close, and how the mental, emotional, and healing happens, preventing the decline. And as Sir had said, that nothing can be talked without a case. And we are going to talk about different aspects, which includes hereditary, psychological, environment, social, economical, and how it plays role in the development of the child and subsequently adult. I'm going to talk about a very simple case, Cornelia de Lange syndrome. This particular patient came to me at the age of 14 months. And there were behavioral problems, there were problems of retardation. The child was looking like a baby monkey with very small head, long eyelashes, low set ears, okay? And he was just weighing, at the age of 14 months, he was just weighing 5.5 kg, no teething, no talking. Kar diya band. His face and expressions were like a baby monkey. Absolutely, he looked like a baby monkey. And you can see on the face how much of hair is present on the body, every part of it. Okay? Bushy eyebrows, you can see before and after. Small nose, thin drawn up leg, features of hirsutism. Life situation. Now this is very interesting. The mother belonged to a particular community where the dowry was to be given. The first child was female child. Second, when she got pregnancy, the amniocentesis was done. Second was also a female child. And she got pregnant again. Again, amniocentesis was done. It was a male child, which was continued. Okay? During the sleep, she would get up suddenly with a jerk. And this was present even in the child. See how emotionally disturbance somewhere affects the deeper aspect of the child. Okay? She would get worried. Another thing which was very important, she felt neglected during the pregnancy. And this was the main reason she went through a big problem. And now what did we find? Craving for, in spite of mental retardation, in spite of so much of problem, what did we find? There was craving for sweets, constipation, stool on alternate day. Patient was very hot. See, understand, in spite of behavioral problem, developmental problem, the child never wanted to cover. So why homeopathy? It is very important that even at this stage, the characteristic symptoms were present. Sweat plus, fan is must, loves air conditioning. Birth weight was 2.2, cleft palate which was operated. Mother had cold, maternal grandfather diabetes, no major illness. Clinical representation, fontanelle level open, hair plus 10, eyebrows bushy, undecided testis bilateral. Symptoms which we considered, speech delay, growth retardation, behavioral problems, poor sleep and appetite, mental retardation. Low birth, facial features like a monkey, hair growth, hirsutism, undescended testes. So symptoms totality was development arrested, retarded child, hairy, shy, food, drinks, desire sweets, open fontanelle. And these symptoms were repertorized. And this observation was very, very important. And the developmental and mental emotional aspects were considered. Delayed cognitive and emotional growth. Behavioral development was absolutely arrested. And selecting the appropriate rubric would help So these are the things which we considered. On repertorization, you can see sulfur, calcarea, lyco, and other remedies are coming. Now, why it is important to repertorize? Because it gives us a complete picture and the range. And then we have to apply the filter. We applied the filter to understand what can be. So here the hot filter was applied, and you can see the remedy has changed. On the top, it is medorinum, sulfur, lycopodium, and the series of it. And then we applied the cross. There were few symptoms which were crossed, like developmental arrested, imbecility in children, and desire for sweets, and hairy. So these symptoms were crossed, and we get only one remedy. So sometimes, we get some doctors who say that everything is there in my head. No. There are a lot of times you need help of a system. There are hundreds of features of the software which I will not talk about it, because then otherwise bolenge ye to software bechne aaya hai. I had a long talk with Manoj and Bipin. Now we understand the medorinum, what it came. So because of the retardation, we started with a lower potency. First follow-up, the child became very playful, active, follows the object. See how just 3 doses, 1 week, change attempts to get up. And these are all, see the change, recognize the object, like mango. Mango was brought in front of him, he would move his head accordingly. Now this recognition, see the shift which was happening in a retarded child. Tooth eruptions. Do we stop the medicine? Yes or no? Huh? According to this, what? The body has reacted now. Medicine band karna hai ke chalu rakhna hai? Very good. Who said that? Yeah. I love you, yeah. You are absolutely future homeopath. Done. You deserve a nice gift from all of us. That's the spirit here. तूने बहुत अच्छा train किया इसको. Yes. We need to continue medicine, and why, I'll tell you. The criteria of evaluation was falling of hair. Until the time hair do not fall, that means the thing is going deep down to the miasmatic level. We cannot stop. Turns, recognizes, active or rolls, wants to go out. And if you take him out, he will, when you bring him back to the home, he will say, no, no. He will make the actions. Okay? So he wants to go out again. Improvement continues. Can recognize people, objects, mixes around with everyone. Now, improvement continues. Hair fall +5. Can recognize multiple objects. We put him on placebo. Straightway on placebo, and few weeks, months, again on placebo. Considerable improvement, performance mentally, physically, emotionally, and see how the things have changed. 9-year-old. And what is the mental age? 4.5 years. A completely given up case. Those who know Cornelia de Lange syndrome, you understand. Completely given up case. Can understand instructions in 3 languages, English, Hindi, and Gujarati. Understands the command, recognizes voices of people, makes an attempt to speak on phone, can hold pencil and scribble, loves to listen to music, plays Casio. See how the shift has happened. And can play with others, makes signals and gestures, likes to keep things in order. He comes from outside, he puts his shoes, he puts his socks, everything in order. Has developed good coordination between pictures and words. Sleeping is normal. What do we learn? By considering these various aspects, using repertory analysis, we can aim to find a suitable remedy. to have unique psychological development and physical characteristics. The holistic approach to healing considers individual as a whole, addressing both mental and physical well-being. The homeopathic repertory is a representation and integration of specialized software we have used in homeopathic practice, and accurately you are able to understand the emotional state and the mental state. So we have to select the right rubric. We have to find the right remedy. Keen observation is required and deep understanding of rubric. I am sharing a list of psychological rubric. Can you share that in the link? I have shared it. Just what you opened the right file previously. And this database is very useful. Abhi mat kar. You don't find me, huh? This is not me, for sure. Okay? So such evidence only gives us faith in the pathy, and we have to help every patient with openness, like Dr. Devadiga beautifully said, 150%. So all of us have to give our 100% plus contribution from her, 50%. Makes it 150%. Thank you very much. I have many more cases in the line, but the signal came from inside. Please wind up. So once again, I want to thank you from my heart and soul, and I want to thank Memorial Trust and very effective. And I'm sure as the time passes, they will have a book very soon on psychiatry. Thank you. Now I'll wait here. I know, you don't have to say. I learned from Prabhakar, I have to be here.
Thank you, sir. Thank you so much for your wonderful and insight presentation. I call upon Director of Research, Dr. Prashant Tambuli, sir, to felicitate Dr. Javasha.
Gandhi ji ka follower लगता है अभी. Thank you very much.
Thank you, sir. Thank you so much.
Our next speaker of today's seminar is Dr. Anand Kapse. He'll be speaking on utility of psychological principles in homeopathic practice. Dr. Kapse is professor and head, Department of Organon, MLD, MHI. Is director, Dhawale Trust Hospital at Palghar, member of Board of Studies, faculty Homeopathy, and member of Academic Council of MUHS Nasik, and former member of the Maharashtra Council of Homeopathy. He is a passionate teacher of Organon and Repertory and has deep interest in Repertory, and with his clinical experiences of nearly 4 decades, he is going to bridge the gap of theory and practice brilliantly. Dr. Kapse, please come in.
Good morning, everybody. At the outset, I would like to congratulate the entire team of Foundations of Psychology and Homeopathy for feeling a need that I experienced as a student. When we studied homeopathy, I don't think I have appeared for or answered any question on psychology or psychiatry. So we passed our homeopathy without studying psychology. And I'm happy that henceforth all the students will have a standard book to refer to which integrates homeopathy and psychology. I think Prabhakar has already handled this aspect of the inevitable role that Hahnemann has given to mind in our homeopathic practice. You know, because a student will always have a question, why should I study mind and what I am going to do with it? And some of the excerpts from Kent, they are very revealing. You know, what is the power of homeopathic medicines? Like it has been demonstrated in the cases presented by Dr. Jawahar and Prabhakar. Homeopathic medicines have the power to change the whole moral nature of man, to relieve and give control of passions. So this is something to be experienced, to be believed. I still remember a daughter of a surgeon who came to me. I gave her medicine for tonsil, and the wife comes and tells me that her fears have disappeared. Or somebody who comes for migraine, I give her a medicine and she comes, I don't know, doctor, what medicine you have given me, and my sexual desire has come back. So these are experiences which we are not even given medicine for that. The patient came and volunteered. This is the power of homeopathic medicine. And there is a certain model of relationship. Between a doctor and patient, which Kent has focused. He has conceptualized physician at the center and patients with various degree of their orientation and faith in homeopathy or understanding of homeopathy in circles around, from intelligence to ignorance, and how a homeopath becomes their friend, philosopher, and guide. And all of us experience that in our day-to-day practice. He goes much beyond and he says, homeopathy is an art and science of life because it is a study of living beings. For a homeopath, study of man, his mind, body, is a necessary thing. There is no way of escaping it. The study of man as to his nature, as to his life, as to his affections, underlies study of homeopathy. This is what Kent says. And so far in the homeopathic syllabus, the mind as a part of study was not given that much prominence. Boger has given a lot of importance on observing the patient's behavior. And he says that all great prescribers are intuitive observers of human beings. That is the level to which he believes a homeopath has to develop that, ingrain those habits. And understanding patient's mode of thinking, his involuntary ideas. This is what Boger says. I was very much surprised when I read that from his lesser writings. Boger is in touch with what is happening in contemporary psychodynamic field. And what is the case taking of a psychoanalyst? And what is the case taking of a homeopath? How much time a psychoanalyst takes to understand the nature of his patient and his conflicts? Boger makes a reference to this. I have not seen any reference to psychoanalytics in any other homeopathic master's literature. Now, this is the importance which our philosophical masters have led. But as I shared with you, when I completed my LCH, my understanding of the mind was minimal. And my case taking was, akele rote ho, ki sabke samne rote ho, and all that. Now, from there, to study mind was possible only because I joined ICR and I learned under the trinity of gurus, MLD sir, Kumar sir and Tiwari sir. And that initiated me into study of mind. So these are homeopathic concepts that are part of SCR, which are available to a person who has not even studied psychology or psychiatry in depth. it is something which a common homeopath can understand. I pride myself in calling myself a common homeopath vis-a-vis all these dignitaries who are homeopathic psychiatrists. So, we follow Hahnemann, we try to become unprejudiced, we try to get the portrait of disease. There is a difference between a complaint and a problem. A physician has to start understanding. These are all principles. Are we prescribing for the symptoms, the form, or are we prescribing for the patient? And what it is for prescribing for the patient? What is my model of man? Because when we start then studying the patient as a person, my model of man becomes important. Am I clear of what is my model of man? And when we read our masters, we have to realize that each master has a different model of man. So their investigation of the patient and the totality that they create is based on that model. Like Kent followed Swedenborg 100%. And he introduced the whole Swedenborgian model of man in homeopathy, and we are unconsciously, we have adopted that. But we don't know what is that model. And then from that, where he starts with that spiritual model of man, we have the other master, Whitmont, who has applied the Jungian psychology, psychoanalytical theory, to our portraits. Now, what is the type of case receiving, case exploration that would be necessary to create a portrait like what Whitmont has done? And do we understand that model? So, study of man has multiple roads. As many schools of psychology or psychoanalysis, as many schools, and homeopathic masters also have followed different masters. But at a common level, all of us are agreed about the symptomatology, the various levels of mind, emotion, intellect, behavior, subconscious, its effect on functioning. No, these are accepted. There are no differences. The important concept of symptom, state, and disposition. I think disposition has been referred to quite a lot. Have I developed understanding of classifying and understanding my patient's symptoms, his prominent state, and his nature, which may have undergone change? What Hahnemann has asked, pay attention to the deviations in the state of disposition. And is homeopath only a prescriber who gives remedy for the patient, or he has the ability to define the problem which the patient presents with and has a role to play in resolving that patient by suitable interview? So this expands the role of the homeopath. And all this, beyond the point when we start realizing, is not possible without acquiring certain knowledges and applying them in integrated way. And this is where the book like this and maybe many more books that will come have a role to play in shaping a homeopath. And it is very, when I was reading this book, I remembered my introduction to mind was not through psychology. It was through abnormal psychology. And that interested me because it had so many interesting cases of patients which I could relate to and understand, that understanding mind became easier. And therefore, I was very happy that this book, particularly in contrast to many ICR books, is very simple to read and has many illustrations, case studies. So it is something which a student in college, undergraduate college, will understand. And that is the beauty of this book. And my introduction was through that, abnormal psychology and modern times. And it put me on a journey. So, but in general, how much of mind I need to study as a homeopath? Because I'm not studying only mind, I have to study all various subjects. There is a psychology which tells me what is normal. There is abnormal psychology or psychiatry. Then there is psychodynamics, which tells me about what is not obvious, what is hidden in the subconscious. And there is psychosomatics, which tells me the relationship between mind and body. One definition of psychosomatic is how much of body and how much of mind, because every man suffers as a whole. There are no suffering which are only physical or only mental. Suffering is simultaneous. So, and what is the role of emotion? What is the role of a personality in generation of illnesses? the theory of organ weakness, which tells that under stress a particular organ gives up. So all these are concepts which a homeopath can use in his day-to-day practice. I mean, now that I am completing 40 years of practice, a man is prone to go back and have nostalgia. So while preparing for this lecture, I tried to list all the cases which came to me without ever having put anything that I have any psychiatric knowledge. And I realized that practically all common psychiatric illnesses have visited my clinic, and I have been able to do something for them. In fact, I remember we had a symposium on mood disorders way back in 2003-04. And I had a practice of around 20 years by that time. And I was able to take out from my register 50 cases of depression, which I had managed till that time. And out of which finally I was allowed to present 12 cases in that symposium. So, I mean, depression is a part and parcel of homeopathic practice and life. You know? So I would like to share one of that, because that is something which any homeopath will get the patients. Whether they come with telling you that it is a depression or they present with some other complaint and you find out that there is an underlying depression. The other disorders, some of them may be belonging to more experts like mania, bipolar disorders, frank schizophrenia, acute states. A homeopath may or may not have the competency to manage them, depending on how much he has studied. But depression, I feel, and other neurotic illnesses, they are part and parcel of homeopathic practice. And another find, I mean, many times we are foxed. I remember 2 cases which presented with depression. I gave them homeopathic medicine, and it turned out one was a presentation of hypothyroidism, a psychiatric presentation of hypothyroidism. And another patient who came to me with a frank presentation of aurum depression turned out to have a large tumor in the brain. And the presentation was depression. So mind and body, they go very close. And we need to have awareness and studied both the aspects. This is what my practice has told me. This is a case which I had presented in that symposium. Amongst all the 50 cases, this was the case of most profound depression I have witnessed. There is a photo in a psychiatric textbook, I think in the Cole, of that depressed faces with the lips down and all that. This patient was a picture of that depressed faces. For 1 month, he was in acute depression with suicidal thoughts and all the classical symptoms of depression, which occurred because there was a dissolution of partnership. He was a car finance dealer, and the partner had cheated him and there was a dissolution. And he had felt that that partner had spread rumors in the market about him, and which has tarnished his reputation. And therefore now he won't be able to conduct his business properly. In his own way, कि पहले मैं 50,000 का धंधा करता था, अभी 500 रुपए का धंधा भी करना मुश्किल है. So he was seeing everything dark, lost confidence. And there were 2 such earlier episodes. Earlier he had consumed tranquilizers, he was hospitalized. So this was the 3rd episode of depression. Major depressive episode. These are recurrents. Now the issue that a homeopath faces is, should I manage this case? What if he commits suicide actually? Should I be managing this patient on an OPD basis, or I need to admit this patient? So all these judgments are required, and you need to assess the suicide risk. And only if you have some background knowledge, then you will be able to decide whether to manage this case or not. Fortunately, I realized that the suicidal attempt was not so serious, and he had responded promptly, so I decided to manage him. This was the totality. He was before the sickness, he was a very industrious man and extravagant man. Means gold, living the life of the gold, luxury life, and working 18 hours a day. And from that, he had gone into another swing where he was unable to work, sitting at home, totally depressed, weeping, that state. I gave him a dose of aurum mate. for him. And the way he reported and advised him to take a break, he said, well, the moment I took that powder, I had a sweet sleep. Sweet sleep is different from a tranquilizer sleep. And in 7 days, he was completely all right and he could resume work. 1 dose. So when we understand this power of homeopathic medicines and the knowledges that would be required to manage these patients, to assess. So I have assessed his emotional state, thought, cognition, affect, all that. Now that knowledge would be required for a homeopath, and the response that you get is far superior than the conventional allopathic medicine when you get the same element. I have just tried to list all the pediatric psychiatric cases that, or neuropsychiatric cases I have managed. Sexology. There are dearth of sexologists in India. And people are afraid also and cannot afford going to sexologists. And they come to homeopath. And I'm really happy that whatever training I received at ICR, and Emil Dhawale sir was the first person to spot my ignorance about sexual functioning. You were there, madam. You were there, and then he asked her, give him Kama Sutra to read. And that was the time I got initiated into reading books on sexology. And I read other Masters and Johnsons and other books. But that training that helped me to manage a case which gave me my MICR. I will share that case with you. This was a case after 10 years of my practice. I was already married, so I had some experience now in the matters. And a couple came, presented with IBS. Now, IBS is a known psychosomatic entity. She did not come with infertility or sexual problem. She presented with IBS. It was after some effort that my wife discovered that she also yearns for child. She was 38-year-old by that time. Husband was 39. And then she discovered that they have not consummated the marriage. So there is a presentation of psychosomatic illness. There is a sexual problem. Then we diagnose that she is frigid. She has no interest in sex. And she is depressed. So there is a simultaneous psychosomatic illness. There is a psychiatric illness of chronic depressed state, dysthymia, and sexual dysfunction, frigidity. Then we persuaded the couple, the husband also, to join treatment. She was sepia, and that is not a very difficult point, and that is not the focus of this presentation. And the husband wrote a very beautiful history describing the feeling state that he has been passing through about his sexual power, his failures, and how he's palpitating when he thinks of having a sex. And again, it became a very interesting point. He had hypertension, again a psychosomatic illness. He had a very difficult childhood, which had left its scar, an authoritarian father, suppressed and repressed mind. Work in Gulf, where the physician added to the guilt by advising masturbation as a releasing mechanism. And he was in guilt that I have done masturbation, so I will be sexually not competent. He gave an advertisement soliciting marriage with widows and divorcees, thinking that he will not be able to satisfy wives, so a widow may tolerate him better. Then he got married late. He married without looking at the wife, and he found that she was unattractive and unresponsive. The way he described was that usually by night both would be tired, so he would try to have sex in the early mornings when he would get up, and the wife, when he is in the mood, wife will tell him, go and have brush. By the time he will have brush, mood will be gone. And there was no consummation. And the expressions were available in multiple dreams. Now, why I have selected this case is, now all the knowledges I talked about, psychology, psychiatry, psychosomatic, and psychodynamic, all these knowledges had to be used in understanding this case, arriving at the remedy, and going beyond the remedy in handling the couple. So the theory of, or the methodology suggested by Masters and Johnsons of a couple handling, therapeutic couple handling a patient couple, that we used to interact with the husband and wife. The wife was advised or cajoled to change her role and become more responsive. The man who was finding or searching for a more supportive father figure, he interacted with me to relieve his anxiety. And eventually, the couple succeeded in consuming the marriage and having a child. Now, such a complex, integrated knowledge a homeopath can use, and following the homeopathic knowledges of philosophy, repertory, and materia medica, along with the ability of counseling. So these are all potentials which I learned at ICR. Without that initiation, I still remember, because I had asked a question, because in SCR there is a way, are you able to satisfy your wife? Sir asked me, can you tell me what are the signs that a woman is satisfied sexually? I was bold. I had not read anything. So there are areas which a student needs to read. There is no option to knowledge. So this was the problem definition that I have arrived at of the couple, the concepts that I used, and the way we advise them and help them come out of this problem. Psychosomatic. By definition, MLD has written homeopathy is a queen in the field of psychosomatic illnesses. We reign supreme. Our potential in management of psychosomatic illnesses is maximum. And that common psychosomatic illnesses, most of us, I have listed them, you will know. But you know, I was working in a joint and rheumatology OPD, and we discovered that an orthopedic illness like osteoarthritis, which is supposed to be degenerative, is actually a psychosomatic illness. And there is a very well-researched book that we could find out on non-surgical management of osteoarthritis, which lists the kind of emotional stresses which aggravate the pain of osteoarthritis, making it clear that the radiological changes of osteoarthritis have nothing to do with the intensity of pain that the patient experiences, and the mind plays a lot of role in the pain of osteoarthritis. So even seemingly non-psychosomatic illness, when homeopath studies them, he is able to find out that there is a psychosomatic aspect, and therefore he necessarily studies the mind of the patient, and which is what Hahnemann told us from the beginning. These are some of the books that helped me as I went on advancing various books. I'm sure there are many more books, because I still remember when the syllabus of psychiatry was created, we had interaction in the faculty, and I found in the psychiatry syllabus there were some 70, 80 books which were recommended readings. So I told Kumar sir, maybe you are the only person who has read all these books. So the knowledge is infinite, and you can keep on expanding as per your interest, as per your time, and as per the cases that come to you. These are some of the books I had found useful. And they, how much time I'm left with? Khatam. So this is, in nutshell, study of mind and body is essential part of homeopathic study. All homeopaths know that. So we are essential practitioners of psychosomatic medicine. We always study what is wrong with the mind, what is wrong with the body, and are they connected either way, cause or concomitant. Maybe mind causes body, body causes mind, or they occur together, but we always study that. Therefore, basic study of these four disciplines, and I'm happy that Jawahar sir suggested that next book should be there. One book is there, so next book should be in pipeline, and I hope eventually all these four books in relation to homeopathy will come into existence. For a homeopath, sir used to say, every case is a challenge, because homeopathic practice is not routine. And each individual comes or brings with him something unique, something different, and which helps us learn something new. So application of these knowledges, these principles will definitely help us relieve the patients better and give us a more professional satisfaction. And I am sure that this foundation of psychology and homeopathy is a milestone in this study of mind that every homeopath takes. Thank you.
Thank you, Dr. Kapse, for a very insightful presentation. I call upon Dr. Sunil Bhalinge, Director Training Study Groups, to felicitate Dr. Kapse.
I think I call upon our teacher, our mentor, our guru, Dr. Kumar Dhawale. He's an inspiration to all of us. I think Sir needs no introduction. As a leader, he has transformed the organization into a hub of excellence of education, research, and community care. And beyond the institutional, he was the founding principal of MLD MHI. And beyond the institution, Sir has served as a former member of Board of Governors of Central Council of Homeopathy and on several committees of Central Council of Research in Homeopathy. I request Sir to please come and introduce the book. Thank you.
Thank you, Nikunj. I'm glad that all the three speakers have made my work easier, because all of you have really outlined definitely the need of psychology in our syllabus. We have dedicated this book to our mentor, Dr. Tiwari. And all the authors, including the editors, have learned from him and have learned lessons of life which we all value. Dr. Devadiga mentioned in a very profound way that the discovery of homeopathy preceded psychology. And homeopaths, as a result of that, which Dr. Kapse has spoken, have developed approach to patients in their own way. So we have had Kent, we have had Whitmont, and we have had a number of other practitioners. Psychology came, very surprisingly, psychology has been there in our psyche since ages. Greek, Indian, all these thoughts have incorporated psychology. But experimental psychology started almost 80, 90 years later. So Wilhelm Wundt was the person who established the first laboratory in psychology in Germany. So our problem when we were conceiving this book was, one, to incorporate these scientific and experimental approach to psychology and link it up with homeopathy. And what really has helped us is what, again, Dr. Devadiga has mentioned in a very profound way, the different aphorisms of Organon, which have formed a bridge, which has linked up the discipline of psychology and homeopathy. The background of this book actually started when our postgraduate students who were training with us, they were assigned the task of delivering lectures to UG students in psychology and psychiatry. Obviously, in the previous syllabus, there were very, very defined 10 sessions of psychology, 10 sessions of psychiatry. But our students were trained by us in methods which are now current. So the first method was that we were trying to teach them a proper logical flow of the curriculum, and I will try to define that which underlines the book. The second was our integrated approach and case-based training. So this was the background of the UG syllabus, and We are really very fortunate that Dr. Tarakeshwar has been very supportive in the whole idea of formulating the UG syllabus and incorporating psychology. Dr. Jain sir, there was a lot of pressure in trying to reduce the marks in psychology. And we had to really persuade to maintain the 50 marks in the PHMS Part 1. In the logical flow that we have tried to follow, apart from the first where we lay down the basics of psychology, in the second part, what we do is that we try to elucidate the different facilities or faculties of psychology, which I will come to later. And basically, we have tried to follow a systems-based approach. And this is what I would like to, again, when we talk of the bridge between homeopathy and psychology, homeopathy is a system. Homeopathy is a system, it's an open system. It's a system which depends upon the input, the processing, the output, the feedback. And in a similar manner, we are trying to study the whole branch of psychology on a similar basis. And at the final stages, we try to look at the applied aspects of psychology. And there we are talking in terms of the personality, we are talking in terms of the conflicts, because that is something which is very important and which touches us on a day-to-day basis. And we are also looking at the relationship of homeopathic principles and to materia medica and repertory. We took efforts to try to publish this work in the homeopathic links, and there are 2 articles, one on the teaching of psychology and one on the teaching of psychiatry. So basically we have tried to handle each of the themes, that means each of the chapters, on the basis of anatomy, physiology, psychology. We have talked also in terms of the philosophy, the repertory, and the materia medica. When we talk of the case-based teaching, our cases are presenting a scenario. And in the scenario, we are looking at what are the knowledge, what are the attitudes, and what are the skills that are required by a homeopath. And then we are looking at the result and the feedback and what is the reflection of the feedback. So we try to incorporate all these in the caselets that we are presenting in order to illustrate principles. I will tell you very briefly about the structure of the book. Each of this, there is an elaborate contents, there's an elaborate learning objectives. So each of the chapters carries learning objectives in the beginning. Then there is, as I mentioned, a logical unfolding of the different chapters through and following a system-based approach. We have followed the case-based approach. We have followed the integration with philosophy, materia medica, and repertory. We have tried to correlate, and that is a little distinctive part of this book. We have tried to get into Indian psychology, and we have tried to look at what are the parallels between our Western, or what we call as modern psychology, and traditional Indian psychology. And the conclusions and summary. Each chapter carries a conclusion and a summary, and additional readings which comprises of both homeopath as well as psychology. This is the basic systems that we are trying to follow. Mind as a system, and as without going into any technicalities which a psychoanalytical or any involved approach would undertake. We have tried to keep a very basic systems approach in which all of us experience thoughts, emotions. All of us try to bring those thoughts and feelings together into a concerted action. We produce a result, a feedback, and then we learn from that. And this is what we have tried to incorporate as a basis of the entire approach. Hahnemann's concept of man is the basic foundation on which we have raised this entire book. So at every stage, we have kept homeopathy as close to psychology as possible. And we were lucky because this concept of Hahnemann's concept of man is very close to the way in which the Indian philosophical concept approaches. So hence we found it easy to correlate the Hahnemannian principles, Indian psychology, and modern psychology. So we start with introduction to psychology and the relevance of psychology to homeopathy. Then we go on to the different chapters, and each of the chapter has been captioned in a peculiar way, which gives a very good idea as to what, say, behavior is the external face of the mind, or motivation is a fuel of the mind. So when we are looking at these chapters and the subcaptions, we are giving a clear idea of how a systems-based approach is getting formulated. Then we are bringing all these chapters together in chapter 11, where we are talking of the functional organization of the mind. Then we deal with the applications. And finally, in the last chapter, we look at how all these knowledges come together when we are actually encountering the patient. So case receiving, case taking becomes the final culmination of this book. This book gets linked to our other publications. Dr. Manoj Patel and Dr. Madhavi have brought a detailed book in terms of how knowing the mind in homeopathic practice is, how it is done. Dr. Tiwari sir's book is talking of the process of unprejudiced observation. And Dr. Bipin Jain's book is talking about the application at the level of materia medica. So these are the gems that we have collected, or our authors have been gems. And they have been polished remarkably well by Dr. Mrs. Belsare, who has been our publishing advisor. So I will request Mrs. Belsare now to tell us about how this polishing has occurred, which has resulted in this book. Thank you.
Thank you, sir, for a crisp and detailed way about introducing the book. Bringing out a book is not easy. It is a complex process. There has been a continuous dialogue between the author and the editor, and this can be a very tedious process. So, yeah. Now imagine if there are 8 authors. This is what Mrs. Belsare has handled. The task is Herculean, and who better than the person who has accomplished this task, not once but for all the books published by MLDT. I invite Mrs. Belsare, Advisor Publications Department of Dhawale Memorial Trust, to talk on challenges of publishing a multi-author book in homeopathy. She is an educationist, a literary scholar, and a poet, is a rarity in our homeopathic world. She's been associated with Dr. MLDT Trust since the inception and is instrumental in the quality production output of the Institute. More than a dozen books have been published by MLD Trust since the inception. Mrs. Belsare can take over.
माइक आप पकड़ोगे हाथ में?
हाँ माइक चले कैसा करूँ? Good afternoon to all of you, all the dignitaries and guests of honor, and all the students and their
relatives. I will speak now of the challenges of publishing a multi-author book. What are the demands of book writing? We will begin there. The obvious demand is that there has to be a topic and a readership. By this I mean that you have to have a need for the book that you sense in the potential readership, and you have to have a topic which has been your topic of study. The not so obvious needs or demands are there has to be a focus and an intensity in your effort. There has to be a knowledge base, a wide general knowledge base, and a specific knowledge of your topic, in-depth knowledge, so that what you are saying is relevant and useful to your readers and not just ornamental. You have to have an experience in the field. Durga Bhagwat, who was a great literary artist in Marathi, once told me that you have to have tapas in the field. Now in Sanskrit, the beauty is that tapas has two meanings. Tapas is doing penance or work, and tapas is a period of 12 years. So you experience the field for 12 years, or you have the kind of in-depth experience which amounts to a very large experience, then you open your mouth to speak. And you need to organize your thoughts, and you need to be very logical, because otherwise you become haphazard in your presentation. You don't cover the area completely, and then it is not useful to the readers. Like Arjun, and we all know the story. While in the process of training, Arjun and all the Pandavas and Kauravas were taken to a river bank by their teacher Drona, and told that there is a bird on the branches of the tree nearby. You have to pierce the eye of the bird by your arrow. Quite a few of the students were unable to spot the bird only. Then those who spotted could not focus on the eye. But Arjun just said, tell me when to release the arrow, because the bird is there and the eye is there. When this kind of intensity is there, and when this focus is there, then you hit the bird's eye every time. Now, these are the challenges of book writing. And it is said that every person has at least one good book in them to write. Now, a book represents an integration of knowledge, perception, and focus. We have spoken of knowledge and focus. Perception is also needed, because perceptions differ from person to person. And what you need to do is bring that aspect of perception to the book, to your book, which is very apt for the area. Now, there are many authors in this book. So there are many perceptions. There are many potential books, because each of them, all the 10 people, they were capable of bringing out a book on each of their chapters. They had so much knowledge packed inside them. But we had to bring out a single book. So all of that has to be compressed, and at the same time it had to be simplified. One of the authors told me during one of the, when we went on sounding people, after each draft was corrected, we returned it to them and then said, "Kaisa laga re baba? Kya hai? Does it agree with what you are trying to say? Or is it something different than what you are trying to say?" So one of the authors told me that, Madam, what you people have done is amplified my point, at the same time simplified my point. Now that was the aim of our editorial effort. So what was the challenge? How to resolve this multiplicity of focus, of intensity. There was one author who returned, we made comments, we returned a draft to them. We asked them to think about what we have done and communicate further. One of the authors would return the draft within 7 to 8 hours and then tell us कि अभी हो गया, काम हो गया, madam काम हो गया. And when we went back to the work, काम काफी बाकी था. And another author went on taking days, weeks, even months to complete the editing. But when the work was returned, it was really good. So this kind of thing, how do we sort out? The solution we found in what Dr. MLD, our sir, used to say, that discipline solves solutions. The first part of the book writing was preparing a content paper where you put down the entire central idea of your chapter or your book in about 1 to 2 pages. That is all. Then you focus on what you have to write. I think it is a little different. Huh? I am not used to speaking on PowerPoints. I am just used to speaking. Sorry? Just shift the... Then you have to do a lot of referencing. You have to really know what others have said in the area, and then what further you can say, contribute to the field. And then you have to get guidance from our editorial team. And you have to have a dialogue. The problem is that we are all people. So as Dr. Kumar brought out the thoughts, feelings, commitment, result, complex, all of us have our own personal spaces, our thoughts, our feelings, and the variable commitment. So it is quite likely that we may offend when offense is not meant, or we may take offense where offense is not meant. The team passed through all this and came to a conclusion because there was good faith and trust in each other. Then we had to shape the paper. There are about 108 illustrations in the whole book together. And there are multiplicity of cases, caselets, just focusing on the point in each chapter, which brings out the whole thing. And there are some areas of knowledge which have to be covered. Like if you are speaking of behavior, then you have to bring in Pavlov and Skinner, who were the behavior scientists. Without that, you cannot really focus, because that is where modern behaviorism began. And when you are considering behavior, you have to take into account their efforts and their insights. Or if you are speaking on motivation, which is another chapter, you have to speak of the motivational ladder, which has been put down by Abraham Maslow, which takes you from the primary needs of food and shelter up to the point of where your need is to self-actualize, to go beyond yourself in the service of humanity. Now that kind of knowledge and that kind of focusing and padding up of the chapters has been done by the editorial team, and the authors have responded to it. The authors have contributed on their own a lot of things. The editors have the challenge of being responsible to the readers and to the authors and to the subject, which means that they have to simplify to the extent. Now this book is written for the first year BHMS. So they are all 18-year-olds and their vocabulary is much, much limited. So you have to write in a very simple way. I think Dr. Kapse mentioned this, that it is a book which is much simpler than the usual ICR books, where there is a lot of telescoping of ideas. We had to unsort all the ideas, strands of ideas, and put them simply so that it reaches the audience, and the audience find it within their reach so that they understand it. That was an editorial challenge. So we had to reflect a lot, we had to guide a lot, and we had to provide a lot of encouragement for the authors, because it is very difficult to write a book. It is comparatively easier to speak, because when you are speaking, you can go back and forth. When you are writing, once you write, it is there. So people can go back to it and refer to it. And it has to be linked in a very logical way. So how do we all, the editorial team, feel about this? We feel very proud of our authors. And we feel very happy that we were able to bring the book out in such a short time with such intensity. I hope you enjoy, all of you enjoy reading the book.
How long the pregnancy lasted?
It was to be released in July. One year. It was planned ideally to be released in 9 months, but it took 1 year. Thank you.
आपल्याला तिकडे
I think when we talk of mind and homeopathy, among the first few names which comes in our mind is Dr. Manoj Patel. And I think he's going to talk on how to use this book and the tips to the teachers and also to the students who are going to use that. Dr. Manoj Patel is the trustee of ML Dhawale Trust. He's been the former professor and head of Department of Psychiatry, MLDMHI Palghar. And he's been a speaker at numerous national and international forums. Last year, Dr. Madhvi and Sir released the book, Knowing the Mind in Homeopathic Practice. As an ardent student of homeopathy and homeopathic mind, even after formally quitting his position, he's still a student and he's delving more into the mind and he's pursuing his PhD in qualitative research in homeopathy. I invite Sir on stage to talk about tips of how to use the book.
Thank you very much, Nikunj. Today is his birthday. Happy birthday, Nikunj.
The book is gift to you.
All dignitaries, various professors, teachers, students, it's very, very privileged to be part of this book. I have learned writing, and Dr. Kumar sir must have lost remaining few hairs. And this is how I started writing. And probably in this book, first time I made attempt without taking major support, and I must have given him still more trouble. So it's a very interesting journey. And while you are writing this book, It's very, very interesting process which you go through. Next. Hahnemann says mind is the key to man. And I'll say that a book on foundation of psychology and homeopathy is the key to mind. There are journey which you take in this chapter. Sir has talked about the whole book. I am now talking about each chapter. I'll give one example of the chapter. The chapter is laid down in a way that there is area of must know. There is a definitions. There are some processes which undergraduate student must know. So that undergraduate student was a very active part while we are writing. When I started writing, it was so complex that the process of simplifying was the biggest challenge. And this simplification is very important for undergraduate college, specifically first year students. So selecting various examples which starts from their age group, their identifications which is possible. So book is being written and laid down with this understanding that there are areas of must know, there are areas need to know. There is no choice, but you have to learn to know more. And there are areas which is nice to know. And all these three aspects is being covered so that ultimately what Anand Kapse talked about practice of homeopathy, you are capable of practicing homeopathy. You are capable of understanding miasm, which Dr. Devadiga sir talked about, of psychiatry, which is written in 210 to 230. I always go to all seminar and tell students, go for option, these 20 aphorisms, 5 mark short note, either on delusion, either on this. And we miss out on the most of the part because foundation of psychology is not there. And that's why we don't understand this very important organon message. So I think this book is tribute to NLT sir and tribute to even Hahnemann, that probably he must be smiling today. Now comes to teacher. Important part of teaching is students' engagement. How do you engage student? And how this book will help you to engage student in a much better way. So the whole process of effective teaching lasts from facilitator. The teacher has to have some method and strategies. And book will provide you this method and strategies as an examples. Finally, if you understand the intricacies of each topic of this book, and that is where teachers will come in picture to make this book still easier for students to understand and making more interesting to read, is going through literature, going through various processes, and go back ultimately. When your knowledge improves, your eye is able to see what your mind knows. So go back to OPD. From OPD, you take up cases, and that cases when you bring down to the classroom, and this book will help you to do that by laying down of one chapter. I'll tell you, chapter number 2, where we have done this planning. So general plan is very important. How do you plan your entire curriculum-based education? And in that, plan the content of this particular topic and chapter, which is being laid down. So emphasize the understanding of the mind is fundamental to homeopathic practice. And this should be established from its go, from its beginning. And relate broader knowledge of Indian psychology and Western psychology. And I say Hahnemann falls in between. Their entire discourse between Krishna and Arjun is full of psychology. Basic principles of psychology. Sat, Chit, Anand, and various aspects of mind which is talked about in Indian philosophy is being covered. Which you see in Hahnemann, who was into practice and he understood mind through practice. There were no theories of psychology, which has come up later on after him. But it is very interesting. If we go back to Hahnemann's way of looking at the practice, gradually the knowledge of psychology will improve and the nice to know area will come up. So in chapter 2, we have done all chapters have been done like this. First, there is an introduction of each chapter itself. Then there are various process which has been, the content of chapter which has been laid down. I have highlighted like what we have discussed about Hahnemannian concept of mind in health and disease. Now this is the part of the second chapter. How do we incorporate that with various examples, setting various objectives? So this content will lead you to proper formation of objectives. Importance of mind as seen by various stalwarts, and importance of repertory, homeopathic materia medica in understanding mind. So book, again, will help each teacher. So this is why setting the learning objective is very, very important for each class to cover up, whether it is 1 hour or 2 hours of that particular class which has to be covered. The book has support for that teacher, even for student to understand when they go ahead. In this, various objectives are set. I'll just highlight one of the objectives, explaining the Hahnemannian concept of mind and its constituent, namely thinking, feeling, and behavior. This is one of the objectives. Now this objective, if you have to realize in classroom, how do you go about? There is no other way but to go to Hahnemann. He has learned everything while practicing. While he was in practice, he learned. So bring case to classroom. Create various assignments. Make them write various stories. And I'll tell you one paragraph and how many components you will be able to see. Leela is a first-year medical student. You will realize now that we have selected cases so that student can identify with that case. And the mind known area becomes very easy for them. An introvert, and she finds demand of medical college overwhelming. She is far from home, terribly missing her mother and friends. Her roommate frequently finds her with headache, weeping, feeling overwhelmed and hopeless. Leela feels that she does not fit in with her peers, who all seems to be confident and outgoing. Since some time now, Leela feels lost, alone, and contemplating to leave her study. This is how we have made so simple. Can you identify what is thinking here, what is feeling here, what is her behavior, what is attendant seeing her? So various questions comes up. Now if you have created entire assignment based on this, and tutorial is being done in a small group where brainstorming is done, student will be able to identify various things by themselves, and the interest will be generated through that to go ahead and explore why someone behaves like this, how various symptoms comes up in various mind. And then the journey from symptoms to mental state and mental disposition, which is the very complex aspect, can be understood gradually. So various questions to be raised and questions to be addressed. That's the adult learning principle. Each student should not be directly fed, but they should be helped to generate. And there is a knowledge here. There are reference reading. We will come to that point. And the teacher can easily use various models. The whole book is illustrated with such figures, models, and various examples and caselets. That's why it goes beyond 400 pages. To make it simple, we had to elaborate. To make it complex, we could have in few lines. Here the job is done so that everyone, any beginner in homeopathy will find it easy to go. So this is the model. Sir has laid down this beautiful model on which you can understand Kant's classification of symptoms of mind, and also you can understand behavior of patient. So we see behavior, and from there you can understand what has gone to commitment of Leela, why she wants to go back home, what is the feeling she goes through, what is the thinking she goes through, and automatically they will understand what is happening inside the mind. So even this type of various models are being circulated inside the book. Journey travels from very simple to various complex aspect. Ultimately, everything needs to be integrated. Today's seminar demonstrated, I'm not going in detail, but everywhere there is mind. Whether you go to proving, there is mind. Whether you go to Organon, there is mind. Go to Materia Medica, mind. Not only mind, there are complex terminologies there. And we are not able to understand. So this book will provide you various aspects of simplifying this aspect of what is written in Organon, what is written in Materia Medica and Repertory. Not only that, infusion with anatomy, brain's functioning, to physiology. So how mind is correlated to all subject, and this will become very, very interesting. Thank you very much, sir, for introducing this subject. And I'm very sure the struggle what Anand has gone through, first year student will not go through in his practice. Ultimately, our goal is to take them to practice and encourage them through this process of various reflection. Because psychology is a subject closest to all of us. We know mind, but we don't know various terminologies. From childhood, we have explored world through mind. But now mind itself, we have to study. We're using that tool is a complexity. The subject is complex. We have to try to make it easy to understand for beginners. So it starts from nice to know, must know, ends into nice to know with a lot of reference readings, which is there. And one of the very beautiful chapter I personally liked was chapter 11, Functional Organization of the Mind. Sir has given his best to this chapter. But before reaching to 11, you have to go through the first 10 first. And then you can understand how various system which is operating inside us. If you understand this 11, now for you, easy is personality, easy to understand developmental psychology, and easy to understand conflict and resolution. The final tip is to go to practice. All what we have studied, ultimately our final goal is to take outcome to the practice, what Anand has beautifully described, so I'm not going into that. But holistic patient care, enhancement of this communication, and message of management, stress management for not only patient, anyone who reads this book will start his journey of knowing himself. Because you identify, you relate, and each homeopath has to evolve as unprejudiced observer. The psychology book is foundation to know yourself and be free. Thank you very much.
I invite all the dignitaries on the dais. Dr. Tarkeshwar Jain, President, Homeopathy Education Board, NCH, New Delhi. Dr. Mangesh Jatkar, Member, Homeopathic Education Board, New Delhi. Dr. Rajkumar Patil, Dean, Homeopathy Faculty, MUHS, and Management Council Member, MUHS. Dr. Kumar Dhawale, Mrs. Rohini Belsare, Dr. Bipin Jain, Principal and Director Academics, and Dr. Madhvi Tamboli, author and editor. I now request Dr. Kumar to felicitate Dr. Tarkeshwar Jain. Big round of applause, please. I request Dr. Kumar to felicitate Dr. Bangesh Jhatkar. And I request Dr. Kumar to felicitate Dr. Rajkumar Patil, Dean MUHS. Thank you, sir. I request Dr. Madhvi Tamboli to hand over the books to all so that we can start the book release ceremony. Please, I request all the dignitaries to release the book. And a big round of applause from everybody. Everybody must be waiting to see the book, and here it is. You can see the cover of the book. Thank you so much.
The function will not be complete without felicitating few important people who have made it to today's this book releasing function. And we want to acknowledge their presence here in spite of their busy schedule. Dr. Rosario D'Souza, sir, the principal, Dr. Gadkari, B. Gadkari, Homeopathic Medical College. I will want Dr. Manoj Patel to felicitate him. I will also acknowledge the presence of Sri Narsu Patil sir. He is a chairman Disha Shikshan Sanstha, A.B. Gadkari Homeopathic Medical College, Gadi, England. I also acknowledge the presence of Dr. Jay Patel sir, who was my teacher and was an ex-principal of CMP Homeopathic Medical College. I'll also acknowledge ex-ICR, I would say the faculty and the student of Sir, Dr. Sanjay Modi, for being here. And not but the least, the person who is close to our heart, though he is not here, but we can see the reflection of him in Madam. So we will acknowledge, and please acknowledge her with the big round of applause, Madam Tiwari. Thank you.
I think a book cannot come to a reality without the authors and the people who write the book and the people who design the book and the people who work very hard for the book. I think it's time that we acknowledge the people behind this wonderful book. I request Dr. Tarkeshwar Jain sir to please felicitate Dr. Manoj Patel.
He has contributed 3 chapters along with Dr. Kumar Dhawale. Yeah. Thank you, sir. I request Dr. Mangesh Zatkar to felicitate Dr. Sunita Nikum, Professor HOD, Department of Psychiatry. Her expertise lies in managing psychiatric cases at OPD, IPD levels, and she has treated many challenging cases with homeopathic medicines in the Anukampa ward, which was declared as a center of excellence by the Ministry of Ayush. She is involved in academics, community psychiatry, de-addiction initiatives, and the geriatric and child psychiatry areas of the Institute. We are so proud of Dr. Sunita Nikum. Thank you, sir.
I request Dr. Rajkumar Patil sir to please felicitate Dr. Ananya Chitle. Dr. Ananya is a consultant at Mind Management Institute, Pune, and has been the former professor at D.Y. Patil Homeopathic Medical College, Pimpri. Dr. Ananya.
She has worked in autism and she runs workshops for parents and teachers. Thank you, sir. Thank you, Ananya. I request Dr. Rajkumar Patil to felicitate Dr. Latika Agarwal, who is a consulting homeopathic psychiatrist in Mumbai and in charge of the Dahisar Urban Clinic. Tick. She is a popular teacher and also popular with children. Thank you, Latika.
I request Dr. Mangesh Chatkar to felicitate Dr. Rajesh Yadav. Dr. Rajesh is Associate Professor, Department of Psychiatry, MLD MHI, Palghar. Rajesh is passionate about trekking, sports, extreme sports, and I think his area of interest also lies in sports psychology. Dr. Rajesh is also publisher of multiple papers of Department of Psychiatry in peer-reviewed journals. Dr. Rajesh, please.
It's a very proud moment. Dr. Rajesh has come with his father. Thank you, sir. Thank you for coming. Yeah, I request Dr. Rajkumar Patil to felicitate Dr. Mansi Surti, Assistant Professor, Department of Psychiatry, Dhawale Memorial Trust. While staying in the US, she was a counselor at Dansbury Grassroots Academy and served as a research co-guide in Western Connecticut State University. This publication must be a great, very proud moment. Thank you, Mansi.
I request Dr. Mangesh Jatkar sir to please felicitate Dr. Tanveer Sheikh. Dr. Tanveer is Assistant Professor, Department of Psychiatry, MLD MHI. She has worked extensively in the field of geriatric psychiatry, conducted various mental health workshops, especially in the senior living communities all across the periphery which we serve. And she is important in taking the chronic caregivers in CKD. And she's been involved in the research in that as well.
Thank you, Tanveer. Yeah. So I request Dr. Mandesh Shatkar to felicitate Dr. Tamanna Chellani. She was the backbone behind this book. She has created the content and designed the cover page as well. Thank you, Tamanna, for coming all the way from Bangalore. And finally, I request Dr. Tarkeshwar Jain to felicitate the author, the editor of the book, Dr. Madhavi Tamboli. Assistant Editor, Publications Department, MLD Trust. She's also the coordinator of Urban Clinics, MLD Trust. She's the co-author of the book, Perceiving the Mind in Homeopathic Practice. Thank you. Thank you, Madhavi.
All the authors, I think, thank you, sir. I think we will do that right away. All the authors, please come up on the stage for the photograph with the distinguished guests.
We request the dignitaries to please sit, and the authors can stand. So this is a very proud moment for the Institute. And so many authors, so many creative people. Thank you, thank you. Thank you so much. Thank you so much for making this book happen. Your hard work and dedication and many sleepless nights. Thank you. So now we would like to felicitate our speakers. So I request Dr. Manoj to felicitate the speakers. नहीं अभी इधर ही कर देते. Yeah, we'll doing it. So Dr. Jawahar Shah, our speaker. A big round of applause. Dr. Devadiga and Dr. Kapse. Thank you everybody. Yeah, so now we request a guest of honor to Dr. Rajkumar Patil to address the audience. Sir is the Dean, Homeopathic Faculty, MUHS, and Management Council member of MUHS. He is the coordinator, MUHS Regional Center, Kolhapur. He is a professor principal, SJEPES Homeopathic Medical College and Hospital, Kolhapur, and has clinical and teaching experience of over 32 years. Okay, that is a very special mention. He is a teacher of Dr. Madhavi Tamboli. Thank you, sir. Thank you so much.
Good morning. respected dignitaries on the dais, and my dear friends. At the outset, let me congratulate all the authors of newly published book, Psychology and Homoeopathy. I also congratulate Dr. Dhawale Trust for organizing such a grand national seminar on this psychology and homeopathy. It was long time to need having a such national seminar exclusively on psychology for the students, teachers, and practitioners. And this is fulfilled by Dhawale Trust in such a professional manner. There is still great need of having emphasis on psychology and psychiatry in the study of UG and PG courses, as a mental sphere is the core of homeopathy. Hence, though there is no separate subject on psychology, it has been incorporated in Organ of Medicine by National Commission. The psychology will also assist the PG students in psychiatry. I have gone through this newly published book on psychology and homeopathy as a quick glance, and I found it quite handy and highly knowledgeable for the students, practitioners, and teachers. I would strongly recommend it all of you. Further, I would suggest the author to approach University and National Commission to recognize as a textbook. I would request all to cooperate the organizers during the seminar and take home whatever possible for your bright future and career. I also thank the organizers for inviting as a guest of honor for the esteemed national seminar. Thank you one and all, and have a nice day ahead. Thank you.
Thank you, sir, for your kind and encouraging words. I now request Manoj sir to please felicitate Malti madam with the book.
I would ask Dr. Aditya to please come in the front seat.
Thank you, sir. Thank you, ma'am. Our next speaker, another guest of honor, is Dr. Mangesh Jhatkar, sir. Dr. Mangesh Jhatkar is the member of Homeopathic Education Board, National Commission of Homeopathy, New Delhi. He is also the professor and head of Department of Mater Medica at Dhawale Homeopathic Medical College, and has been a clinician and academician for last 30 years. He is an ex-academic council member, ex-chairman of the Clinical Board of Studies, and ex-member Board of Research MUSs. Sir is also a member of the LIC community of MUHS. I request sir to please say a few words.
I wish you a very good afternoon. Respected Chairman of Respected Chairman of Dhawale Trust, Dr. Kumar, respected President of my board, Dr. Tarkeshwar Jain, Belsari Madam, who has addressed us beautifully today morning, Dr. Rajkumar Patil, my friend, colleague, Dean, Faculty of Homeopathy, MUHS, Principal Dr. Bipin Jain, Dhawale Madam, respected Dr. D'Souza, President of E.B. Gadkari Trust, all present principals, teachers, friends, colleagues. At the very onset, I would like to thank Dhawale Trust for having invited me here to be one of the witnesses to this wonderful seminar of today. During the course, since morning, we have been listening to all the speakers, Dr. Devadiga, Dr. Kapse sir, Dr. Kumar also has addressed a beautiful gathering. Now, in the whole process of the book that we have just been listening, and mind, that is the focus of homeopathy in practice, but really speaking, mind is the focus of our existence. And acceptance in life is what is the necessity which the mind has to accept. And once we accept that, all other things are very easy to face in life. This book, which I have just browsed through at this juncture, will give a wide knowledge to the upcoming homeopaths and will make them think in a more methodical manner to treat the patients and to look at the patient with a different view. Not only that, it will help the students because a good sound knowledge of psychology will definitely help many of the patients to be counseled by the upcoming homeopaths. Because the medicines really required are less, but it's the more the satisfaction and counseling during the whole process of treatment of a patient which carries a lot of weightage. I feel this book is all in all going to give a very wide and good authentic knowledge to the upcoming homeopathic students of today. I once again thank the organizers of this function for having invited me here and share a few words with you. Thank you.
Thank you, sir, for your kind words. Now we would invite Dr. Tarkeshwar Jain, President, Homeopathy Education Board, National Commission of Homeopathy, Government of India, New Delhi. He has been the former Managing Secretary, Homeopathy University, Jaipur, former Registrar, Professor and Head, Department of Materia Medica. When we start reading his biodata, it is so long that we really can't say many things about him. So it is extremely decorated. But he is all over, chairperson, internationally connected to universities like LA School of Homeopathy, Hawke School of Homeopathy, London School of Homeopathy, in Malaysia, Thailand, and many other universities. But one interesting aspect is he is also the fellow of Albert Ellen Institute at New York that talks of his interest in psychology and mind. So that is worth noting in his biodata. So please come in.
Thank you very much for the nice introduction. How much time do I have, sir? Up to me? Thanks. I'll start with a very small talk. I started my teaching in the year 2000, so I think I am perhaps the junior most among you all. And when I started teaching, you all very well know that when you start teaching, and you have to teach 3 years continuously for becoming an examiner. That is the rule for every university. Now we have little change, but earlier this was a rule that when you teach continuously for 3 years, you become an examiner, whether it is internal examiner or external examiner. So it was a big milestone to become an examiner. And when I first went to take examination in one of the college of northern India, the college was located in a remote area. It was not very convenient to go over there, but somehow I reached because I was quite excited that first time I am going to take examination of some of the students in Mathematica. It was really exciting to me. So when I started interviewing students, then I was very much optimistic about Mathematica, quite enthusiastic also while studying also and while teaching also. बड़ा पसंद था मुझे ये सब्जेक्ट, बड़ा मज़ा आता था पढ़ाने में भी और पढ़ने में भी. तो when I started taking interview of the students, तो एक टर्म होती है लाइकोपोडियम में, पसिलिमेनस. सुनी होगी आप सब ने सर. लाइकोपोडियम में अगर एलेंस की नोट्स आप खोलते हैं तो वहाँ लिखा हुआ है adapted the person who are having the characteristics of pusillanimous, malicious, spiteful. These are some of the terms used for the lycopodium. तो मैंने एक स्टूडेंट से पूछ लिया कि what is the meaning of pusillanimous? तो he was dumb. उसको समझ में नहीं आया. मैंने कहा हो सकता है my pronunciation is faulty, अभी भी हो सकता है. तो I wrote the spelling. That this is a spelling you might have studied in one of the medicine of your Mathematica. And what is the meaning of this term? He says, sir, I'm sorry, I don't know. Okay, I didn't ask any further question to him. Next student came, again the same term. He also didn't answer. Again, one more student came. I again asked the same term. He also didn't answer. But usually it happens, आपका भी experience होता है कि आप अगर कोई वाइवा में question पूछते हो तो थोड़ी देर बाद वो ओपन हो जाता है. होता है ना, इट इज़ क्वाइट नेचुरल कि वो टीचर जो अंदर बैठा है खड़ूस सा, वो क्या पूछ रहा है आपसे. तो बाहर अंदर आके सारी बातें करनी चालू कर देते हैं कि ये पूछ रहा है, इसकी तैयारी करके चले जाओ। तो मुझे लगा कि अब चौथा पांचवा जो आएगा वो तो डेफिनेटली बताएगा। 40 स्टूडेंट का बैच था, 40 के 40 ने नहीं बताया। तो आई वॉज रियली सरप्राइज्ड कि ये क्या हो रहा है कि 40 के 40 को नहीं पता व्हाट इज द मीनिंग ऑफ पसली मैनस। देन इवेंचुअली अब जो इंटरनल था ना वो थोड़ा सा घबरा रहा था कि अब मेरा नंबर है। He was sitting with me and he was getting restless. तो कभी वो बाहर जा रहा, कभी वो अंदर जा रहा, कभी चाय पी रहा, कभी पानी पी रहा. And when all 40 didn't answer my question, then I eventually asked, not the question, but I why they are not able to tell this. And this is in the Allen's keynote, जो वो किताब है जो हम सबसे पहले हमारा जो exposure होता है मैथमेटिका से, usually Allen's keynote से ही होता है. Later on we switch over to other bigger books or narrative books or descriptive mathematica, but eventually जो first हमारा encounter होता है मैथमेटिका से, that is mostly with Allen's keynotes. इंडिया में जिस ढंग से सिलेबस डिज़ाइन हुआ है, CCH ने जिस ढंग से डिज़ाइन किया है, our first encounter with mathematica is through Allen's keynotes. And lycopodium is a big remedy. Lycopodium is not a small remedy. बड़ी दवाई है, कॉन्स्टिट्यूशनल दवाई है, और उसका एक टर्म है जो कि एलन की नोट में मोटे मोटे अक्षरों में लिखा हुआ है, एंड none of the student is able to answer. Even after when they are going out interacting with each other, still they are not able to answer what that means. So I told, can you give some light? Then he accepted this, sir, even I don't know what is the meaning. Now that is the situation which is actually happening in our institution. That is the actual status of our institution. See, we are standing here in Mumbai. Can you compare Mumbai with some remote village of Maharashtra or some remote village of Bihar or some remote area or even a smaller city of Uttar Pradesh? Can you compare Mumbai with these colleges, with these students, with these teachers? I don't say that teachers कहीं पे खराब, teachers कहीं भी अच्छे हो सकते हैं. मुंबई में भी खराब टीचर हो सकते हैं और उत्तर प्रदेश के किसी छोटे से इलाके में खुले हुए कॉलेज में भी बहुत अच्छे टीचर्स हो सकते हैं. मैंने देखे. I had gone through almost 250 colleges of India and I have found many gems in different colleges of India, whether they are located in the urban area or they are located in the rural area or in the semi-urban area or in the capitals or in the state capital or in the national capitals. Teachers की हमारे यहाँ पे कहीं कोई कमी नहीं है. At the same time, ऐसे टीचर्स की भी कमी नहीं है जो जानना ही नहीं चाहते, सीखना ही नहीं चाहते. तो it was really unfortunate. Why this lacking was there? Why this? And we all know that homeopathy prescription, unless it is based on the mental symptom, it is not going to be a complete prescription. हमारे यहाँ, of course, there should be a combination of mind and body, जैसा previous authors ने बताया, that we should take part of psychosomatic status. And we should base our prescription not entirely on the matter. एक extremism भी नहीं होता कि हम खाली mind पे prescribe करेंगे. ये extremism भी नहीं होना चाहिए, ये bluntness भी नहीं होनी चाहिए, ये stubbornness भी नहीं होनी चाहिए. बहुत सारे ऐसे teachers हैं, बहुत सारे ऐसे schools हैं जो कहते हैं कि हम तो सिर्फ mind ही लेंगे, mind के अलावा हम कोई symptom लेंगे ही नहीं. वो एक extreme है. ऐसे भी बहुत सारे schools हैं जो mind के बारे में बात ही नहीं करते हैं. वो सिर्फ characteristics peculiar या एक single symptom पकड़ते हैं और prescribe कर देते हैं. ऐसे बहुत सारी situations हैं हमारे यहाँ पे. If you go to various colleges of India, you will find different kind of scenario. See, there is one very big institute, National Institute of Homeopathy in Kolkata. Everyone knows about that. It is the premier institute of India. It is the institute of a government of India itself. It comes directly under the domain of ministry, right? Anybody has gone to the OPD of NIH? Just one person, sir? You might have definitely gone. How many patients they are seeing per day, sir? No, sir, not hundreds. In one of the peak time, many times Dr. Subhash make update on the Facebook also, that today NIH visited 3,800 patients in a day. 3,800 patients in a day, seeing homeopathically, prescribing homeopathic remedies. Do you think it's an easy task? If we talk about the principles of homeopathy, if we talk about the totality of symptom, if we talk about the creating a portrait of disease and drug and matching them together in 3,800 patients in a time of 9 a.m. to 2 p.m., is it humanly possible? Do the Bombay school agrees? Somebody was, Dr. Devgadia was talking about the fight of aphorism 153 and 211. This is an actual situation, sir. But do you think this is humanly possible? But don't you think that these patients are coming only to take some sweet pills? Do you think this is happening? That they are distributing medicines for free, they are providing medicines for free, no charges, and people are coming only for sweet pills? Do you think this is the only cause? For whole one day, I sat in the OPD, and I tried to inquire that why this number of patients are there. And I came to know that patients are coming from the far off places, not only from Calcutta or the neighboring area. You'll be surprised to know that patients are coming from the far off places, 200 kilometers, 300 kilometers, और वहाँ पे क्या लाइन लगती है. तो एक जैसे ही वो बस स्टॉप से नीचे उतरता है या ट्रेन से उतरता है पेशेंट, तो सुबह 4 बजे ऑटो वाले चिल्ला के बोलते हैं NIH, 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 लाइन लगती है सुबह 4 बजे से, 2 बजे से. दिस इज रियल स्टेट. तो इसलिए तो वो नहीं आता डेफिनेटली कि उसको खाली मीठी गोली खानी है, इसलिए तो नहीं आता. डेफिनेटली उनको भी फायदा होता है, तभी वो आते हैं. तो देयर इज सो मच पोलैरिटी इज देयर इन द प्रिस्क्रिप्शन. Prescription can be a one single symptom which can lead to the right remedy, how keen and clear observant you are. जैसे डॉक्टर साहब जो केस बता रहे थे अबाउट द प्लेटिना, वो शुरुआत जब हुई तो इट वाज नॉट सीमिंगली प्लेटिना टाइप नहीं लग रहा था, बट द मोमेंट ही चेंज्ड हिज जेस्चर, जैसे इनके जेस्चर चेंज हुए, इनके आवाज़ का टोन चेंज हुआ, अचानक से हमारे को दिमाग में बत्ती जलने लगी दैट इट कैन बी प्लेटिना. तो देयर कैन नॉट बी एनी आर्ग्यूमेंट ओवर द प्रिस्क्रिप्शन. It is very difficult to standardize, to make the uniformity in practice, to bring all the practitioners of homeopathy under one umbrella and giving the guidelines that you have to prescribe only in this way. It is very difficult. हो ही नहीं सकता. Everybody has their own perception, their own way of understanding symptoms, their own way of interpretation. सबके अपने अपने तरीके हैं. बट जो मैं समझता हूँ, why this book is needed, let's come to the point. जो मैंने शुरू किया कि ये एक बहुत बड़ी कमी है हमारे यहाँ पे. हमारी मैथमेटिका इज फुल ऑफ सच काइंड ऑफ टर्मिनोलॉजी, फुल ऑफ सच काइंड ऑफ टर्मिनोलॉजी. एलन तो बात ही इशारों में करता है, उसका नाम ही की नोट है. तार छेड़ोगे तो म्यूजिक निकलेगा, इट्स ए की नोट. तार छेड़ोगे तो म्यूजिक निकलेगा. तो वो तो बात ही इशारों में करते हो. तो चाबी है, अगर आपने ढंग से लगा ली तो समझ में आ जाएगा, नहीं ढंग से लगाई तो समझ में नहीं आएगा. तो अगर आपको टर्मिनोलॉजी नहीं आती, उसका मीनिंग नहीं आता, वो सिंगल वर्ड में बात करता है. तो सिंगल वर्ड अगर आपको पसली मैनस का अगर मतलब नहीं पता है तो आप कभी समझ ही नहीं पाओगे लाइकोपोडियम की पर्सनालिटी कैसी है, आप रिलेट ही नहीं कर पाओगे उसकी सारी चीज़ों को. तो ये बहुत बड़ी कमी है जो हमारे यहाँ पे बहुत समय से चल रही है. बिकॉज वी डोंट नो अबाउट द साइकोलॉजी, वी डोंट नो अबाउट द वेरियस एस्पेक्ट्स ऑफ साइकोलॉजी, हाउ द टर्म्स आर इंटररिलेटेड, हाउ दीज आर इंटरकनेक्टेड, हाउ दीज कैन बी अप्लाइड बाई फॉर एनहांसिंग अवर नॉलेज ऑफ मैथमेटिका एंड इवेंचुअली बिकमिंग गुड प्रिस्क्राइबर. ये हमें पता ही नहीं होता है. तो दिस बुक आई थिंक will fill this gap definitely. When we started designing syllabus for the first BHM, Dr. Dhawale was consistently in our connections and he has helped a lot for framing the CBDC curriculum for the first year BHMS. He and his entire team was there with us. तो psychology was always there in my back of mind कि ये तो होना ही चाहिए. पहले शुरू भी हुआ था CCH के टाइम में भी एक बार, but then again it was removed. शुरू हुआ तो पेपर नहीं था, पेपर नहीं होता तो उसकी वैल्यू नहीं होती. दिस इज़ वेरी क्लियर. अगर किसी सब्जेक्ट का आप पेपर नहीं लेते हो तो आप कितना ही पढ़ा दो उसको क्लासेस में, ना तो बच्चे सिंसियर होते हैं, ना टीचर सिंसियर होते हैं, ना एग्जामिनर सिंसियर होते हैं, और वो खाली कागज़ों पे ही सिलेबस बन के रह जाता है, काम किसी के भी नहीं आता है. तो हमारी पहला टारगेट ये था कि जो हम पढ़ाएंगे उसका पेपर लेंगे. दिस इज़ वेरी क्लियर. सो दिस वॉज वन ऑफ द रीज़न. अगर ये साइकोलॉजी पेपर में आता चाहे नहीं आता तो भी इस बुक की रिलेवेंस तो है सर. आई हैव गॉन थ्रू द पेजेस ऑफ द बुक बिकॉज आई हैव रिटन, आई एम ऑल्सो पार्ट ऑफ दिस बुक, आई रिटन द फॉरवर्ड. तो मेरा भी फेलिसिटेशन होना चाहिए सर इन दैट वे. डिसाइड ऑन द ऑथर्स. द फर्स्ट पेज इज हैविंग माय नेम. Although sir, spelling of name is still incorrect. I told you again, I am not Tarakeshwar, I am Tarakeshwar. I am not Tarakeshwar. It's already very long name. Sir had made me one more A is added in that. I am made Tarakeshwar, which is I am not exactly. तो मेरा भी contribution है थोड़ा सा राइट, बट फॉरवर्ड लिखना इज़ अ वेरी डिफिकल्ट टास्क, क्योंकि आपको पूरे बुक की समरी एक पेज में प्रिसाइज करनी है. तो इट वॉज वेरी डिफिकल्ट टास्क. मेरे को बहुत दिमाग लगाना पड़ा. देन ओनली आई कुड राइट ए फॉरवर्ड विच आई थिंक इज रिलेवेंट टू द बुक. And when I started going pages and pages, chapter by chapter, I realized that this is a very systematic way of writing the book. And book should only be written when it is really required. अभी होता क्या है सर, every second week we are having one book in our office. Sir, please include in our textbook. It should be included. Mostly देखते हैं ना तो कंटेंट जो होते हैं ना वो सब ऐसा लगता है कि ज़रूरत क्या है, दिस इज़ ऑलरेडी रिटन. जो आप भेज रहे हो, रेपर्टरी है, चाहे मैथमेटिका है, चाहे कोई और सब्जेक्ट, इट्स ऑलरेडी देयर. व्हाई, वेयर इज़ द नीड? नीड कहाँ है? बिना नीड की बुक लिखना क्या लॉजिक? अनलेस यू हैव सम इनोवेटिव आइडिया, unless you are filling some gap in the system itself. And I can thankfully say, sir, that this book is definitely filling a gap, which is direly required. The moment we launched the syllabus of psychology, along with the organon of medicine in first year, the first request that came from various teachers of India was, after conducting the CBDC training program in the various zones of India, the first request that came was, how to teach this subject, sir? That is a big problem. We can teach psychology somehow, because we have many books on psychology. But to relate psychology with Hahnemannian concept, that we don't know, sir. For that we don't have any book. So this book is definitely filling a void, filling a gap. And that is the main purpose of book. Book is useful only when it is innovative in ideas, only when it is able to fill up the gaps. इसलिए नहीं होना चाहिए, कई ऐसे साल एक बुक निकाल देते हैं. What is the need? Many people says to me, I am teaching mathematics for the last 25 years, and everybody says that, why don't you write your experience? I say, where is the need? जरूरत कहाँ है? आप सोर्स बुक से लेके अभी तक जितनी बुक्स मैथमेटिक्स की पढ़ी है, सब में आपको आपके जवाब मिल जाते हैं. तो जरूरत कहाँ है? जरूरत जिस दिन होगी उस दिन डेफिनेटली लिखेंगे, लेकिन अभी ऐसा कुछ लगता नहीं है कि कुछ मैंने ऐसा कुछ इनोवेटिव कर लिया जो मुझे लिखना चाहिए. तो अनलेस देयर इज ए नीड, there shouldn't be a book. But this book is definitely going to solve the purpose for our system also, for our syllabus also, for our students, and as well as for our teachers. This will definitely fill up the gap. This is the one aspect which I wanted to say. And I really congratulate the entire team of Dhawale, all the authors who have really done commendable work in a very record time. क्योंकि सारे एक ऑथर को लिखना हो ना तो it becomes easy. एक का ही दिमाग चलना है, एक की फिलॉसफी चलनी है, एक का ही थॉट प्रोसेस चलना. बट व्हेन इट इज़ 8 ऑथर्स, यू हैव 8 माइंड्स वर्किंग ऑन, और उन सब का आपस में तालमेल बैठना, उन सबको आपस में लेके जोड़ना, उन सब का कंसेंसस बनना. आई सी व्हेन वी कंडक्ट मीटिंग तो ऐसा होता ही नहीं कंसेंसस बन जाए, बनता ही नहीं है. इतने आर्ग्यूमेंट्स आते हैं कि बड़ा मुश्किल होता है टू अराइव ऑन ए यूनिफॉर्म कंक्लूजन. इट इज़ वेरी डिफिकल्ट, and that too for writing a book and having 8 authors. It is a difficult task. So hats off to you, sir. I don't know how you have managed. Give me some tips also so that I am able to manage my board issues also. But it was definitely a wonderful task. Besides that, I want to, because all teachers are here, teachers हैं या aspirant teachers हैं, PG students हैं, principals भी हैं, academicians भी हैं. तो सर मुझे कहीं कहीं ऐसा लगता है कि हम जो ये interpretation of symptoms करते हैं वो कहीं कहीं पे ऐसा होता है कि बहुत ओवर जनरलाइजेशन हो रहा है. मतलब हमारा सोर्स क्या है सर मैथमेटिका का? मैं आई एम मैथमेटिका मैन, तो हमारा सोर्स क्या है मैथमेटिका का सर? व्हाट इज़ आवर सोर्स ऑफ मैथमेटिका, ऑफ अंडरस्टैंडिंग ऑफ मैथमेटिका? एक ही सोर्स है हमारा, जो हमारे प्रूविंग रिकॉर्ड्स हैं. बराबर है सर, एग्री करते हैं आप सभी लोग? जो हमारे प्रूविंग रिकॉर्ड्स हैं, जो हमारी सोर्स बुक्स जिनको हम बोलते हैं, वेदर इट इज़ मैथमेटिका प्योरा और एनसाइक्लोपीडिया ऑफ होम्योपैथिक रेमेडीज बाय एलेंस और हेरिंग गाइडिंग सिम्टम्स, ये 3 मेजर सोर्स हैं जिनको हम सोर्स बुक बोलते हैं. तो हमारी मैथमेटिका इवॉल्व किन से हुई? इन्हीं से हुई. मानते हैं सर आप ये बात? जितनी हमारी फ्यूचर्स बुक्स इवॉल्व हुई है, चाहे आप कैंट के लेक्चर्स ऑन मैथमेटिका ले लें, चाहे कैंट की रेपर्टरी ले लें, चाहे नर की रेपर्टरी ले लें, चाहे एलेंस की नोट ले लें, ये बड़ी बड़ी किताबें हैं जो हम यूजुअली क्लासेज में पढ़ाते हैं. इन सब का इवोल्यूशन एक ही बुक से हुआ है, दैट इज़ हेरिंग गाइडिंग सिम्टम. एक ही किताब है जिनसे ये सारी बुक इवॉल्व हुई. हेरिंग, कैंट वॉज एन आर्डेंट फॉलोअर ऑफ हेरिंग, and whatever lecture he has talked on mathematica, whatever the rubrics he has collected in the repertory itself, they all came through hearing guiding symptom. Same is the story of नर. नर तो exactly hearing है. नर पढ़ी होगी सर आप लोगों ने? नर है क्या? नर में तो खाली symptom लिखे हुए हैं, purely clinically verified symptoms, और exactly वही language जो हेरिंग ने लिखा है वहाँ पे, वही लैंग्वेज उसने रेपर्टोरियल फॉर्मेट में डाल दी. दिस इज द वर्क डर हैज डन. इट इज अ वंडरफुल रेपर्टरी. एवरीबडी एग्रीज. अगर कोई सिम्टम मिलता नहीं है वो अलग बात है, लेकिन अगर कोई सिम्टम नर में मिल गया तो आप मान के चलो कि आपका मरीज ठीक होगा ही होगा. अगर नर में मिल गया, मिले नहीं वो अलग बात है, बिकॉज इट हैज़ द लिमिटेशन, इट हैज़ लेसर नंबर ऑफ रेमेडीज. बट अगर मिल गया है आपकी किस्मत से तो आप मान के चलिए इट इज़ ए जैम. ये आपको कभी भी डिसीव करेगा ही नहीं. क्यों? बिकॉज इट हैज़ कम आउट ऑफ हेरिंग गाइडिंग सिम्टम. नाउ व्हाई हेरिंग गाइडिंग सिम्टम बिकम्स सो इम्पॉर्टेंट? व्हाई? बिकॉज इट्स नॉट जस्ट द रिकॉर्ड ऑफ प्रूविंग्स. खाली प्रूविंग का रिकॉर्ड नहीं है ना ये. मैथमेटिका प्योरा प्रूविंग का रिकॉर्ड है. प्योर सिम्टम्स गिवन बाय द प्रूवर. That is the record of Mathematica Pura written by Hahnemann himself. Wonderful book, no doubt about that. Allen's Encyclopedia, 12 volumes. All volumes are containing only these symptoms given by the provers. But that makes Herring's a distinct book, that every symptom which is recorded in Herring guiding symptom is containing proving as well as clinical verification. And that to the multiple time. आप नेटरम्यूर उठा के देखिए वहाँ पे, ये जो हम रेफरेंसिंग की बात करते हैं कि कोई भी आर्टिकल या कोई भी बुक बिना रेफरेंसिंग के अधूरा है, मानते हैं आप सभी. यहाँ बुक में भी आपने खूब, यू हैव डन लॉट ऑफ रेफरेंसिंग इन द बुक. हेरिंग गाइडिंग सिम्टम में आप कोई भी मेडिसिन उठा के देखिए, फर्स्ट 3-4 पेजेस आर डेडिकेटेड ओनली फॉर द रेफरेंसेस. ही डन स्टार्टेड सो लॉन्ग एगो. नेटरम्यूर अगर आप देखते हैं ना तो 3 से 4 पेज सिर्फ शुरू के रेफरेंसेस से भरे हुए हैं कि ये जो मैंने क्लिनिकली वेरीफाइड सिम्टम लिया है ये कहाँ से लिया है. It was so scientifically written, so scientifically presented, and very nice work, beautiful work. इससे अच्छा मैथमेटिका मुझे नहीं लगता कि किसी ने हेरिंग से ज़्यादा बेहतर काम मैथमेटिका में किया है. और हमारा जितना भी फ्यूचर लिटरेचर है वो सारा हेरिंग से इवॉल्व होता है. Another beautiful thing about the book is that every situation which is starting with a clinical case. This is another very important thing, sir. कि वो बच्चे को शुरू में ही मालूम पड़ जाता है कि जो मैं पढ़ने जा रहा हूँ वो अप्लाई कैसा होता है. जब तक हम उसको एप्लीकेशन मोड में नहीं लेके जाएंगे हमारी सारी टीचिंग बेकार है, सर. और हमारा फोकस जो सिलेबस डिज़ाइन करने का है, चाहे वो यूजी का है चाहे वो पीजी का है. हमें बहुत क्रिटिसिज्म झेलना पड़ा जब हमने फर्स्ट ईयर में ही रेपर्टरी डाल दी. वी फेस लॉट ऑफ क्रिटिसिज्म. अनदर क्रिटिसिज्म वाज जब हमने फर्स्ट ईयर से ही बोल दिया बच्चे को फर्स्ट ईयर से ही क्लिनिकल ड्यूटी पे जाना है. बहुत क्रिटिसिज्म हुआ कि फर्स्ट ईयर का बच्चा जानता क्या है, कैसे समझेगा वो, कैसे वो साइकोलॉजी समझेगा, कैसे वो मरीज को समझेगा, उसे कुछ पता ही नहीं है. तो समझेगा कब फिर? आपने जिस दिन जो दवाई पढ़ा दी, आज आपने अगर फर्स्ट ईयर में मर्कसॉल पढ़ा दी, आप तो वापस 4 साल तक नहीं पढ़ाने वाले उसको, गई वो तो आपके सिलेबस से आउट. तो मरकरी का पेशेंट तो पता नहीं वो ज़िंदगी में वापस 4 साल में देखा कि नहीं देखा. कि मैं पढ़ाऊँगा तभी तो दिखाऊँगा. जो मैं पढ़ाऊँगा वो मुझे ओपीडी में दिखना चाहिए. दिस इज़ आवर मोटिव. चाहे हम ऑर्गेनन पढ़ा रहे हैं, चाहे कॉन्सेप्ट ऑफ ऑर्गेनन पढ़ा रहे हैं, चाहे हम कॉन्सेप्ट ऑफ साइकोलॉजी पढ़ा रहे हैं. वॉट एवर वी आर टीचिंग इन आवर टेक्स्ट बुक्स, इन आवर लिटरेचर, दैट शुड बी रिफ्लेक्टेड इन दी ओपीडी और इन दी फील्ड ओपीडी. हमने बच्चों को कम्युनिटी मेडिसिन के लिए भेज दिया, पेरीफेरी पे जाओ आप. आपके यहाँ अगर क्लिनिक में पेशेंट नहीं है, ओपीडी में पेशेंट, यू गो इन द पेरीफेरी. बट आवर ऑब्जेक्टिव इज ओनली वॉट एवर इज बीइंग टॉट इन द क्लासेज should be available to him practically also. This is what we have kept, this is the thought process that we have kept in mind, whether we are designing for the UG syllabus or the PG syllabus. That is the basic thought process. And fortunately, we are having good team. Vipin sir is also with us. Dhawale sir to pura supervise karte hi hain. And we have many good teachers who are associated with, and all are our own teachers. This is the another good thing and satisfying feeling also, that whatever syllabus we have designed till now, we are almost done for the PG now, which will be launched very soon. First year का हमारा हो चुका है, second year we are working upon, and by the end of December हम second, third और final PHLS ये हम भी launch कर देंगे. पर जितनी हमारी टीम है ये सब हमारे ही लोगों की, कोई बाहर का आदमी नहीं है. Even education methodologists जो हैं वो भी हमारे अपने हैं, subject teachers सब हमारे अपने हैं. They have done commendable work. कुछ लैक्यूनाज हो सकते हैं जिन्हें हम कोशिश कर रहे हैं करने की. उन सब में आपका सपोर्ट चाहिए, आपके फीडबैक भी चाहिए, एंड गिव दी ओपन फीडबैक्स. जहाँ भी लगता है ना कि यहाँ कमी है और सुधार हो सकता है, वी आर वेरी ओपन एंड वी आर ready to do that also. So I think I have taken a lot of time. Thank you very much for your patient hearing, inviting over here. Thanks a lot. Thank you very much.
Thank you, sir. Thank you so much for the enlightening and wonderful presentation and teaching all of us. I now request our Principal and Academic Director, Dr. Bipin Chen, to please summarize the event.
Respected Chief Guest, the Guest of Honors, all dignitaries on the and off the dais, all of my colleagues, we had a wonderful day from morning, and we have explored various dimensions in which way the homeopathy gets connected to psychology. And it is a wonderful feeling when we realize that how Dr. Hahnemann was ahead of his time. I mean, Dr. Dhawale has really focused on it, the way he conceived mind, the way he integrated the mind and body. And he also advised us how to take the case and how to do the quality counseling with consciousness. Now, this is very, very important when you are doing counseling. Are you consciousness? You know, one of his case demonstrated that consciousness of 150. So, you know, by how alert you are. And connecting all these explorations on Hahnemann's direction, how do we connect to the repertory was another treat to see. That case was a wonderful case. We would have dismissed it, saying that we hardly have any role. But probably such experiences with the scientific evidence and with connecting rubrics from repertory and connecting to growth and development is one of the dimensions which this book also has got. The physical development is one part of it, but even the psychological development and mental retardation. And how homeopathy changes these dimensions was an interesting thing to watch upon, and connect with repertory was a wonderful connections, again an integration of psychology with the repertory. And who else then, you know, demonstrate the deeper dimensions of philosophy with Dr. Kapse sir has connected with his clinical experiences from a psychology to psychiatry, but he did a journey from psychiatry to psychology. And it was wonderfully demonstrated the utility and connections it has in a day-to-day clinical practice. The most difficult part, probably these cases, these connections, we may have heard sometime or we may have connected ourselves. The most important part was making of a book. I thought, you know, there are very few people who share the journey of making of a book. What is a book about? How did 10 people came together in 10 months? Last 2 months probably has gone for printing and publications and page setting. But I would say 10 people in 10 months coming together and delivering something so beautiful. I think it is a, you know, you're not delivering a child, you're delivering a young, enthusiastic, you know, dashing individual who is born today. And that's the journey. It's a most difficult thing, like Tarkeshwar sir has said, that how do you bring 10 minds together, integrate with the concept of the book, ask them to connect to each other and connect with the concept of book, and making them deliver what is being asked for collectively. Now that was a wonderful listening to all of them and their journey and their inside movements. The word of encouragement from our chief guests and our guest of honor was a treat, because we are further encouraged to take up such projects and bring out something which will fill the gap and not something which will be supplement alone. So now this is a very encouraging words from him. And last not the least, I mean, more insight into Materia Medica, being a Materia Medica teacher. I'm also in love with Herring since long. I get connected with Herring very well. And listening those words, because I have not found many teachers who are advocating, reading, and referring Herring. I mean, majority you find all those synopses, you know, very, and without understanding that how those synopses have been born. If you are connected to the source book and you know how this synopsis is evolved, it's a different ball all together. But directly jumping to synopsis without understanding the foundation is an accident which is frequently occurring with our young generation. So, I mean, it is a good caution, good directions, and he also focused the psychology, part of that mind which Herring talks of, and a lot of those psychosomatic symptoms, or I would say the mental state which is concomitant to that clinical condition. It's not maybe in pure terms of psychosomatic, it is an evolving mental state along with that condition. So over and all, I mean, it was a very, very enriching morning for me, and I hope that all of you have enjoyed this morning. We have tried to integrate academic and scholastic things which will get connected to our day-to-day practice, and which will also direct you how to read, how to refer, and how to make use of this book, both in your practice, in your teaching, and in your own life. Thank you. Thank you for all for coming here. And I would acknowledge a couple of people. I mean, thanks will be given by somebody else, but the couple of people who have really helped in what we are able to connect to the world today. One is our reader in pediatric, Dr. Omkar. Thank you for being around. And another person who has made this whole campaign colorful with her background of being an past ICR student and connected. I am using past. I'll remove that word. Being an ICR student, Dr. Tamanna. I mean, this wonderful marketing is not just a marketing, it is an insightful sharing with all that what this book contains. Thanks, thank you all. Thanks, sir, for being here. Thanks.
Thank you, Dr. Bipin, for summing up so well. Now I invite Dr. Madhvi Tamboli to give the vote of thanks.
Yes, just some minutes more, and then we'll end the session. Respected Dr. Tarkeshwar Jain, sir, President of Homeopathic Education Board, NCH, New Delhi. Dr. Mangesh Jatkar, sir, Member, Homeopathy Education Board. Dr. Rajkumar Patil, sir, Dean, Homeopathy Faculty, MUHS. Esteemed speakers, my colleagues, doctors, and my friends. I stand here on behalf of Dr. Dhawale Memorial Trust and its Publications Department to express my immense gratitude and delight as we gather for this unique national seminar on psychology and homeopathy, and to celebrate the release of the book Foundations of Psychology and Homeopathy. It is truly an honor to be a part of this momentous occasion, and we would like to thank all of you for joining us today. We want to express our heartfelt gratitude to our chief guests, President Homeopathy Medical Board, Dr. Tarkeshwar Jain, sir, guests of honor, Member Homeopathy Education Board, NCH, Dr. Mangesh Jatkar, sir, and Dean Faculty of Homeopathy, MUHS, Dr. Rajkumar Patil, sir, for honoring us with your presence. It was wonderful to have you grace this occasion, participate in the seminar, launch our new publications, Foundations of Psychology and Homeopathy, and felicitating our authors for their unique contribution. Thank you to our speakers, Professor and HOD, Department of Organon, CMP, Homeopathic Medical College, Dr. Prabhakar Devadika, sir, Managing Director, Mind Technologies Private Limited, Dr. Jawahar Shah, sir, and HOD, Department of Organon, MLD, MHI, Dr. Anand Kapse, sir. We are enlightened with your presence and making this such a rich sharing of knowledge. We are again deeply thankful to NCH, the chairman, Dr. Anil Khurana, sir, and the Homeopathy Education Board for its decision to introduce the subject of psychology for the first BHMS that allowed our incredible team to work together to make this book a reality. We must express our deepest gratitude to the authors for this remarkable book. Their dedication, passion, and expertise in the field have culminated in this valuable resource that promises to enlighten and empower readers around the world. Thank you for your tireless efforts and commitment. Thank you, families. Your unwavering support and encouragement throughout this incredible journey. We really could not have done anything without you all. Foundations of Psychology and Homeopathy seeks to bridge the gap between the two disciplines, exploring the intricate relationship between the mind and body and the ways in which psychological factors can influence our health and well-being. It is a hope that this book will serve as a valuable resource for students, practitioners, and anyone interested in the intersection of psychology and homeopathy. We actually want that people read this book, doctors read this book, and give us feedback and suggestions so that we can always better this book in the future editions to come. Writing a book of this magnitude requires not only authors but also a dedicated group of individuals who provide support, guidance, and expertise. Sir has already thanked Dr. Tamanna. So we extend our sincere appreciation to Dr. Tamanna Chelani, our own ICR alumni, a therapist of multiple modalities, for designing an attractive book cover. We also are glad that she has been able to be present for this occasion all the way from Bangalore and participate in this function. But for her energetic and tireless creativity, our publicity would not have reached the heights it has been now. Also thanks to Dr. Omkar. He has done a wonderful job in organizing the publicity of the book. We are thankful to Dr. Shri Milind Vaze and his team at Reprographic Ventures, who have worked at breakneck speed, and to the binders who have delivered the book to us on record time in spite of the 10-day Ganpati festival which has just concluded. We would like to take a moment to acknowledge all our patients who have entrusted us with their stories and struggles. Your stories and testimonials inspire us to continue our exploration in this field and seek innovative ways to improve health and quality for all. We want to express our appreciation to you all, our reviewers, readers, and supporters who have shown interest in this book. Your interest and your dedication to expanding our knowledge in these fields inspire us to continue our work. We hope that Foundations of Psychology and Homeopathy will spark new ideas, foster collaboration, and contribute to the evolution of both homeopathy as well as psychology. Lastly, we would like to thank Mr. Hemraj ji and his staff for providing excellent facilities at Mayor Hall, Mr. Vijay Kumar for serving us a hearty breakfast, teachers and staff of Dhawale Memorial Homeopathic Institute, and all those who have worked tirelessly behind the scenes to make the event a success. As an editor of this publication, my success is due to the constant guidance and assistance I have received from our advisor, publications, Mrs. Rohini Belsare Madam, and Principal Dr. Bipin Jain Sir, from whom I have learned so much through his sharp and relevant observations on the chapter. I must thank our chairman of Dr. M.L. Dhawale Trust, Dr. Kumar Dhawale Sir, for giving me this opportunity. It was a learning experience which I will cherish all my life. Thank you once again for being there.
Program will not be over till we thank our Master of Ceremony, Dr. Nikunj and Dr. Gayatri, for starting program exactly at 10 first. Come on, please. And big introduction, they have summarized, taken a lot of pain. So we are very, very thankful for really starting thing in time and finishing almost in time. Thank you very much to everyone. I have only one request, just wait for a minute. My entire WhatsApp admin team, please come on the stage for photograph. It's your day. Background work is being done phenomenally. This hall doesn't belong to us. We had to prepare for quite some time, and today is a chutti ka din. So please, all people who are involved in admin, medical, non-medical staff, will quick come on a stage for a photo for all your efforts. Fast. Quick. आ जाओ सचिन. Devangini, fast. Quick, time nahi hai. We have to close the door. This is our institutional strength. Wonderful. In just WhatsApp communication, everything has happened without having big meetings. Thank you very much to all of you.
Please do visit the stall where the book can be pre-booked outside, and also check the other publications of the organization. Thank you. Thank you for coming.